Now we're starting. Hey, everyone. Thank you so much for being here. I am thrilled to be at Duke. Can we give Duke a round of applause, please, before we get started? Woo! I want to go ahead and welcome all of you who are here in person. Thank you so much. And all of those watching online for the Summit on Empowering Eaters in Support of Health and Wellbeing for Future Generations. And I just really love this title for so many reasons that we'll learn about today. My name is Dani Nierenberg, and I am president and co-founder of Food Tank with Bernard Pollock. And for those of you who don't know, Food Tank is a research and advocacy organization that works to highlight stories of hope and success in our food and agriculture systems. And we do this with the aim to motivate, inspire, and ultimately activate positive transformation in how we produce and consume food. Again, it's a huge honor to be here in North Carolina and at Duke University. We are coming together to support the goals outlined in the Biden-Harris administration's national strategy on hunger, nutrition, and health. This is a national initiative to end hunger, reduce diet-related diseases and health disparities, and improve public health. I want to thank Kellyanne Blazek and Will McIntee, who are with us from the White House Office of Public Engagement, as well as Catherine Okar, who is on parental leave. They have all done incredible work to advance the administration's really, really important goals. And their leadership has been so personally inspiring to me because they are true public servants. Let's give them a round of applause, please. I am also inspired that the Biden-Harris administration has called on all of us as Americans, everyone in this room, health systems, insurance companies, nonprofit groups, philanthropic organizations, local governments, and other stakeholders to contribute to a White House challenge to end hunger and build healthy communities. And I love that they are using the term communities. No one in this room lives in a community that is not touched by hunger and chronic illness in some way. You'll hear from one of my favorite speakers today who works with food banks, and she uses this term that I really like when talking about the clientele of food banks. She calls them neighbors. All the folks who are experiencing food insecurity and diet-related diseases and other issues are our neighbors, our friends, the nurses and police officers and teachers who live in our communities. They are truly our neighbors. We all need to be part of the solution. The White House's new challenge brings in $1.7 billion in new commitments, building on the $8 billion in commitments announced during their historic 2022 Conference on Hunger, Nutrition, and Health. At the conference, President Biden announced the administration's goals to end hunger and reduce diet-related diseases by 2030 while reducing health disparities. I also want to thank our incredible host and partner, the Duke Sanford World Food Policy Center, especially Norbert Wilson, Deborah Hill, Kathy Kay, and Jack Daly. Round of applause for them, please. Today's summit truly would not be possible without them. I also want to thank Food Tank's team, our event coordinator, Kenzie Wade, and content director, Elena Seeley, for all of their work to build an exciting agenda featuring policymakers, chefs, researchers, advocates, business leaders, farm workers, academics, and other stakeholders. And you'll have a chance to hear from our incredible speakers very soon, but I need to give you a rundown of this afternoon. To make sure we end on time, and I promise you we will, we're going to keep conversations today very fast-paced and dynamic. And if we have to cut panels short, I hope you will forgive me later and understand that we really just want to have a really vibrant discussion all day long. And you will have the chance to continue today's conversations by connecting with the speakers and attendees during our breakout sessions and our reception, which you have to stay for. There will be plenty of delicious food. A big thanks to our friends at Bonterra and Ponysaurus Brewing for bringing a lot of great beverages to this event. Please make sure to step out for water and bio breaks during today. The coffee that you'll all be drinking is courtesy of Counterculture. we don't build breaks in because we want the experience for the live stream viewers to be as exciting for all of us as possible, as those of you in the room. So we have more than 2,500 people registered for the live stream, so say hello to them real quick with a round of applause. And I hope that you'll share today's conversations using the hashtag Food Tank and the handle @FoodTank on all social media platforms. We'll be trying to respond to as many of those comments, suggestions, critiques, and other comments during the day. I'm now really thrilled to introduce someone who I admire very much after having a wonderful call with him. He's very compassionate and a very kind person, and that's Dr. Greg Albanese, the CEO of the Duke University Health System, to welcome everyone. Over to you, Craig.
Thank you, Danny. Good afternoon, everyone. Welcome to the Empowering Eaters Summit. As Danny mentioned, I'm Craig Albanese, the CEO of Duke University Health System, and it's really a pleasure to be here with you this afternoon. And Duke's delighted to co-host the summit with our friends at Food Tank, which, as you know, is a nonprofit research and advocacy organization that highlights stories of hope and success in our food systems. We have a wonderful slate of speakers and facilitators who bring their expertise in policy, agriculture, public health, advocacy, and other key sectors to this exciting forum today. So you may be wondering, why is a health system CEO talking about food? Well, there are three reasons. First, food, or lack thereof, significantly impacts everyone's health and well-being. Second, partnerships and summits like this one hold absolutely immense power. And third, and this is personal, it's just heartbreaking to me that there are adults and children in the U.S. that go to bed hungry every night. As we all know, food is a key driver of maintaining health, recovering from illness, and helping manage chronic disease. Food as medicine is a scientifically proven remedy. But many people don't have access to affordable, healthy, or culturally relevant food. These issues are prevalent nationwide and even in our own backyard here in Durham. Fortunately, healthcare has undergone, if you will, an awakening with respect to social drivers of health. And these are defined as the non-medical factors that play enormous roles in the quality of life and health outcomes. They include socioeconomic factors like income, education, the physical environment such as housing, relationships, and food security. This is part of our mission at Duke Health. We're so much more than what I would term a transactional healthcare organization that simply just cares for you when you're ill, acknowledging when you're ill without acknowledging the whole person and how that person's health is affected by his or her environment. Rather, we at Duke Health care for our neighbors. Through the full continuum of life, we strive to improve community health, and we discover through innovation and research new ways to heal and to prevent disease. Addressing social drivers of health is absolutely critical to doing this well. Duke also has a role to play as the largest employer in Durham. I want Duke to be the employer that provides a pathway to economic mobility and stability, which in turn will positively impact the aforementioned social drivers, leading to a healthier community. To do this well, we need partnerships. No single organization, expert agency, or industry is able to tackle large systemic issues. Now, I don't have the answer to these big questions, but I do look forward to the dialogue that will be taking place here today. Healthy debate and discord will lead to innovative and collaborative thinking that will hasten impactful solutions. That's the power of summits like this one. It brings together a tremendous amount of intellectual capital. The speakers, the in-person and virtual attendees, and organizations like Food Tank. We need all of you, all of those joining us virtually, and your networks to help catalyze the type of change our community and our nation need to overcome food insecurity. and the chronic diseases our patients are experiencing. So thank you for coming together today. Thank you for advancing this conversation and action around these challenges and opportunities. I want to thank our organizers, speakers, and guests, the White House and our policy leaders for their leadership and focused attention on food security, health, and well-being. Our food tank partners, Danny Nierenberg, Bernard Pollack, and their team for their unwavering dedication to creating productive conversations and movement towards solutions. From the Duke World Food Policy Center, Norbert Wilson, Deborah Hill, Jack Daly, and Kathy Kay, thank you for designing today's program. It's a pleasure to see such a diverse group of panelists from various sectors. And our academic colleagues from Duke and across North Carolina, community-based organizations, policy advocates, and experts from across the state and the nation, and key staff from Capitol Hill joining us together today to lend their perspectives so we can learn and grow together. And of course, a big thanks to all those who helped make today possible. So now I'll hand it over to my esteemed colleague and friend, the Mayor of Durham, Leonardo Williams. Thank you.
Good afternoon, everyone. It's a pleasure to be here and bring greetings on behalf of and today I'm going to speak on behalf of the city of Durham, and I'm going to, because geographically we're one and the same, I'm going to bring greetings as well from the county of Durham. So I bring greetings to you from the over 326,000 residents of Durham City and Durham County. And this is the city of culture. This is the city of fun, coolness. I love to say Durham is dope. We are, dirty Durham. There are lots of reputations outside of Durham. We say keep them. We're fine. So trust me, you're in a great place today. I am originally from rural North Carolina, far down east, and I won't speak long, but I did want to say that I grew up in the church, and I would hear the testimonies, where someone stands up and say, I just want to thank the Lord for allowing me to see another day. And I, too, thank the Lord for that. But however, oftentimes people would avoid going to the doctor and they would continue their same practices. And I attended just as many funerals as I did family reunions. And it was always because of the same thing. We are what we eat. And in one of the most agricultural parts of the state, we had some of the most unhealthy eating practices. And that is something that is very concerning to me personally. I'm now in Durham, mayor of one of the largest cities in the state. And we have a lot that we can brag about. And I want to share some of those things. And I'm going to speak these things because I want to make sure that they are an example for what we can share across the state. And across our country, and hopefully across our world, our globe. So Durham County and City was one of the first to incorporate a county food security officer whose mission is to provide food resources for those experiencing food insecurity. There have been several high-profile events, actually, Secretary Janet Yellen has talked about. In Hunger Durham is a coalition of multiple stakeholders across our community, and I've personally had experience with them where we fed about 32,000 elderly and homeless and about 50,000 meals of those who were displaced during the pandemic with my restaurant. Also, the Durham Public Health Department is an award-winning, innovative nutrition. They have what's called a DINE team, Durham Innovative Nutrition Education Team. This is a phenomenal program. No one else in the country is doing it like we're doing it here. And they basically work with state and federal partners to administer the SNAP Ed programs through partnerships with our school system of over 32,000 students, over 3,000, 4,000 staff members. and also the local farmers market. Also, as a not only mayor, but as a restaurateur, my wife and I really encourage restaurants to source locally with our local farmers market, our local farmers, the Black Farmers Network, just farmers within the region. And that's something that's very successful. And also the Double Bucks program allow WIC residents that are on WIC participants to actually double the value of their funds to ensure that they can participate in the local farmers market. And we definitely utilize and leverage technological resources to help us map out where these resources are for residents who need them. So Durham is doing a lot, and I think that's why it's so special that you all are here today. So again, I bring you greetings on behalf of Durham City and County, and we really hope you have a great time in Durham. Spend money. We love your tax dollars. That's what the mayor is supposed to say. Thank you from the White House to the state all the way down. Thank you, Director Nierenberg, for just making this happen, and your entire team. So grateful to have you all. Enjoy your day.
Huge thanks to Craig. I love Mayor Williams. Thank you so much for being here. Durham is dope. Thank you. I am now excited to sit down with my friend Will McIntee, the Senior Advisor for Public Engagement at the White House Office of Public Engagement, and Rachel Ferencik, the Senior Program Officer for the CDC Foundation, to help us set the stage for today's conversations. While they're joining me on stage, I'm really, really excited to share a video by North Carolina Governor Roy Cooper, who couldn't be with us, but was really excited to contribute this video. Thank you.
Hi, everybody. Governor Roy Cooper here. I'm glad to join you today to discuss the important work of ensuring that North Carolinians get affordable, healthy food. The Biden-Harris administration is doing great work to address hunger and nutrition all across the country. Last year, we directed over $1 million in federal funding towards school breakfast programs. And this past week, we added another $1.3 million. We know how important it is for children to have healthy meals so they can learn and grow. Let's continue our efforts to achieve the goals of ending hunger, reducing diet-related disease, and improving the health and well-being of communities across North Carolina. The work you're doing is critical for the health and the future of our state. Have a great event, guys.
Thanks again to the governor's office for providing that video. We're so glad that he could join us virtually. I want to thank Will and Rachel for being with me on stage. They have been incredible partners in this administration's endeavor to really end hunger and improve health and nutrition across the country. I think the first thing that I want to talk to you both about is the importance of collaboration and partnerships with this work. You've had to really mobilize a lot of different folks, unusual suspects, if you will, and I'm hoping you can share with us some about of how that worked and how long it took. Will, do you want to go first?
Yeah, happy to. First of all, thank you, Danny and Bernie and Kenzie and everybody at Food Tank for hosting this event and helping us to foster these connections and these collaborations. We had a very exciting week at the White House. Danny joined us on her birthday, actually. Happy birthday again.
Thank you.
For our event to celebrate the White House Challenge to End Hunger and Build Healthy Communities. So folks may know that President Biden hosted the first White House Conference on Hunger, Nutrition, and Health in over 50 years in September 2022. Ahead of that conference, we did a lot of listening. We did a lot of talking with partners, stakeholders across the spectrum in the private sector, food sector, health sector, nonprofit and community-based organizations who are doing work to help eliminate hunger and reduce diet-related disease. State and local governments. Great to have the mayor here and to hear about all the incredible things happening here in Durham. But really to both, to help to inform the national strategy on hunger, nutrition, health that we announced and lifted up at that conference, but also to foster commitments from external partners to help us achieve the goal of ending hunger and reducing diet-related disease by 2030 that President Biden announced at that conference. And so that's really a recognition that while the national strategy outlines several steps that the federal government can take to achieve that goal, that we really need a whole of society approach to help tackle these issues, which is why it's so important to have such a wide range of stakeholders here in this room today, and why it was important for us to continue that work to build additional commitments. And so following the conference where we announced over 60 commitments that were aligned with that national strategy, we actually announced a new challenge in March of last year to foster even more commitments. And we were excited to this Tuesday lift up 141 new commitments through an event with the Second Gentleman, Secretary Vilsack, leaders from HHS, and other leaders from the White House to celebrate those commitments that have been made to help us achieve the President's goal of ending hunger and reducing diet-related disease by 2030. And again, really important to have such a diverse set of stakeholders that are doing this work each and every day.
Thank you so much, Will. Rachel, I feel like the CDC Foundation is all about collaboration. It's all about bringing people in. Can you talk a little bit more about that and why that's important to you and important to what the administration is trying to do?
Sure, happy to. And again, Danny, thanks for having us here. Some people don't know the CDC Foundation, and we are separate from the CDC. We were created almost 30 years ago by Congress to actually help mobilize resources for the CDC. So our sweet spot is really public-private partnership, and we do that. That's what we've been doing for the last 30 years. We were honored to be asked by the White House to help with the commitment. And one of the things that my colleague said to me about some of the early days of working on this is how people wanted to be connected with different types of partners, and they often didn't know how. Okay. So we spent a lot of time making those connections as the White House was looking at those commitments. And so it was really important that we make those connections. And what we're going to try to do moving forward is to continue to track the commitments that have been made, as well as find more efficient ways to make these connections happen. So that's what's really important to us.
And you had a big announcement recently, am I right?
We had a big announcement on we're launching a action collaborative. So we're really excited about that. We have a webinar next Wednesday, March 6th, and that will help to keep the partnership initiative moving. So we're really looking forward to that. We want to lift up some of the commitments that you might not have heard about, and so we're bringing some different community partners together, and we're really excited about continuing this work.
Thank you so much, Rachel. Will, from talking to you and from talking to Kellyanne, I feel like there are several programs that are of great importance to keep moving forward. And I know one of them is summer EBT, and I'm wondering if you can talk about that. Not everyone knows what that is and why it's important.
Yeah, absolutely. So, we mentioned all the commitments that were lifted up through the White House challenge. The administration has also been working, really hard and diligently to implement that national strategy on hunger, nutrition, health that was announced at the White House conference in September 2022. One of those initiatives is implementing the summer EBT program, which is an additional grocery benefit for eligible families with children to be able to afford groceries during the summer months when they're not receiving breakfast or lunch or school meals at school. And this was a program that's being implemented by USDA through partnership with the states, tribes, and territories. We were excited that in the first year of the program, which is this year, 37 states, I believe 3 tribal nations, and all territories have adopted the program and are working. Thank you. Are working towards implementing that program for this summer. Of course, this is a program that every state could utilize, and we would love to see all 50 states and additional tribal nations be able to utilize this program that's so important for families and for our children. And USDA will continue to work with those states that have not adopted the program for this year and are already in touch about the application process for 2025. But we certainly encourage you. I know North Carolina, fortunately, is participating in the program. I know we have some folks from other states that may not be, and of course, happy to make those connections with USDA for more information if you'd like to. Just educate folks in your state about the benefits of the program.
Absolutely. You used this term with me, I think, last week, that summer should not be the hunger season for children in this country. And I think that's something that we can all get around. So the states that are remaining, they have a lot of work to do, but they can reach out to you and get that work done.
Absolutely. This is a new permanent program, and so we are, as USDA continues to say, they will continue to work with anyone to make sure that we reach as many children as possible through this program. And we're excited that this program will impact 29 million children this summer.
Yeah, it's very exciting. Thank you for that work. Rachel, you talk about public-private partnerships like they're an easy thing, but they're not always easy. And I'm wondering if you can talk about what makes that collaboration and those connections really possible.
Relationships. It takes a while to build those relationships. And I would say over the last, 3 years now, after the pandemic, CDC, there was some lack of public trust. And so we had to, it was really important to us to continue to help build that trust. Yeah. So, I really say it's about building those trusted relationships. We try to operate as an honest broker, not always having an agenda, but to actually bring together folks and give them a space to talk, to work together.
It is all about relationships. It's about being in spaces like this one and talking to folks and getting them excited. So that kind of leads me to my next question. What are you, Rachel, excited about from today in this sort of discourse that we're trying to have?
I was thinking about that and looking at the agenda. 3 things came to mind. The first is the obvious one about partnerships. This work has to be about partnerships. We have to think about breaking down silos and working across boundaries in order to make change. The second thing is I would love for the conversation to include multi-solving so that we're thinking about multiple problems being solved by one investment or one solution. And to me, nothing is more ripe than the issue of climate and the food system. So that, I think, is important.
Thank you for bringing that up.
Yeah. And then the last one, oh my goodness, I lost my thought. I thought about it. So important is that this work really, it has to be rooted in community and have meaningful engagement and leadership by those with lived experience. So I'm really looking forward to that being lifted up today as well.
Thank you so much, Rachel. Will, what excites you most? This is not your first event with us. What excites you most about being here in North Carolina?
Yeah, I think, and the mayor touched on, the important intersection between agriculture and our food system and how North Carolina is really a crossroads for all of that. And so really excited to be here in a room of very diverse perspectives and, coming at these issues from so many different angles. I mentioned earlier, being able to foster those 141 commitments in partnership with the CDC Foundation and their incredible work, wouldn't really be possible without opportunities like this. We were, pleased to be able to attend other food take events like this that allowed us to connect with so many different stakeholders across different sectors, and so excited to have this opportunity to kind of continue to connect the dots, continue to see those partnerships take place throughout the afternoon. And I think Rachel kind of hit on some of the topics I'm really excited about. The opportunities for partnership in food as medicine, the importance of sustainability and the environmental issues that we face. Opportunities to continue to connect the dots as we look at food access and affordability, and connecting the dots with our local and regional food systems, ensuring that our farmers, our farm workers are seeing a fair share for what they produce and the hard work that they do, while also ensuring that that all Americans have access to healthy, fresh food. So really excited for all the panel discussions, but even more excited for the opportunities to have conversation and to find ways for us to collaborate.
Thank you both so much. I think they both said it so well. It's all about connecting the dots. There are so many issues that we have to link together because they're already interlinked. And so I want to thank you both for your commitment to this work, for being here today. Thank you both so much. You stay. You stay right here. Now I'm really excited to welcome our other panelists, the director of the Duke World Food Policy Center and professor of food, economics, and community at Duke Divinity School, Mary Oxendine, fellow at Pot Liquor Capital, Eric Weeby, the treasurer of the board and a member of the leadership committee for the Emmanuel Food Pantry, and Justine Post, the program director for the Rural Advancement Foundation International USA, also known as RAFI. So as they take their seats, we're going to give them a big round of applause, everyone, and help me kill some time as they get settled. Thank you so much. Norbert, my friend, it's so nice to see you. I've known Norbert for a long time. He was at Tufts. I'm a Tufts alum, so thank you for being here, and thank you for all the work that you do, and thank you for being our, I keep saying comrade in arms as we have done this work.
Thank you so much for having us.
So I want to ask you, Craig mentioned this sort of whole person health approach, and you've talked about that need for a holistic understanding of what impacts a household's risk of being food insecure. Why have we not been looking at this whole person holistic approach in the past? What has prevented that?
Yeah, I think sometimes it's, thank you. I think sometimes it's just easier to come down to a single metric. Let's just find the one thing that we can identify, and if we can measure it, we've got it. But we recognize that when we talk about the issue of food insecurity, it is a complex system that people are a part of. And it's not about just getting folks access to food, which is important. I would never want to suggest that isn't important, but it's also recognizing that people live in communities and there are family situations, and there are just challenges with the larger society that we need to address. So it does take that whole of society approach to address this complex issue.
But as somebody who I know is an agricultural economist, data is very important to you. Those metrics are very important. So how do we I think what I'm trying to ask is, how do we break people out of their silos? I mean, that's kind of what we're trying to do here today, but how do we get individual sort of professions and parts of academia, especially, to break out of that?
Yeah, no, this is a really good question, and it's funny. I'm working on a different project related to this on food waste, and we're talking about convergence, and this idea from NSF that different disciplines should come together, and not just different disciplines in the academy, but also working with community groups to actually recognize the shared knowledge that we have, to move beyond and to actually really taking the risk of reaching across difference to come up with innovative solutions, to come up with solutions that we could never come up with on our own. Right. So it's that kind of innovation that I think is necessary for us to move forward. And I'm just really grateful for this panel, because I think it reflects exactly this idea that it's going to take folks who are working in community groups, nonprofit sector, the university policymakers to come up with these solutions.
Absolutely. Well, if I can come back to you, Norbert mentioned community groups and the innovation that is within folks with lived experience, and they don't often get noticed as much as they should. So I'm wondering if you can talk about some of the programs at the national level that include those folks with lived experience and their expertise that are currently in place to reduce hunger.
Yeah, happy to touch on a few, and before I get to that, maybe even talk a little bit too about some of the work that we did to connect
Please.
with leaders with lived experience in the lead up to the White House Conference on Hunger, Nutrition, Health. So we hosted a series of listening sessions that helped to inform the national strategy on hunger, nutrition, health, including several that were with community leaders who had lived experience with hunger and diet-related disease. These were incredibly important conversations for us to have, very, very enlightening conversations for us to have. And we've had some of those conversations have continued, especially through the agencies as they continue to implement the national strategy. I wanted to touch on just a couple of the steps that we've made, areas where we've made progress on. The first pillar of the national strategy was around improving food access and affordability. And since the conference, USDA has invested nearly $30 million in American Rescue Plan funding to 264 school districts to support them in improving the nutritional quality of their meals. We mentioned earlier the implementation of the summer EBT program, hugely important program for families with school-age children to be able to afford food during the summer months. Right now, part of the policy discussion in DC is actually centered around protection of a couple of the programs that we have really fought for and advocated for in this administration. One area I wanted to highlight is the importance of fully funding the WIC program. The administration continues to call for additional funding from Congress to be able to cover what is currently about a $1 billion anomaly in the WIC budget, which would mean that some eligible families who are eligible for WIC may not be able to receive the benefit if the full funding amount is not funded.
Right.
So we continue to call that out in addition to the need for additional states to take on the summer EBT program. USDA also importantly updated the Thrifty Food Plan as well around SNAP, which is another area that we continue to call out the need to continue to keep that intact, that important reform.
Can I interrupt you right
Absolutely.
there? Can you explain what the Thrifty Food Plan does and why it's, you've already explained why it's important, but what does it actually do for folks?
Yeah, essentially it updated the amount that families receive based on the price of groceries and in their localities, and so it was the first time that had been updated in many years.
Right.
And so this is important, especially now as families working families are working to be able to afford food. This helps to families to receive a benefit that's closer to being able to fulfill their needs.
Right.
And so this is an area that we continue to advocate the need to keep that important update intact that USDA made.
So important. Thank you for explaining all that. I think it's helpful for really setting the stage. Mary, we've been talking about folks with lived experience, so I'm hoping I can turn to you because you work very closely at the local level, and I'm wondering what services are available to producers in North Carolina who are trying their best to produce local, sustainably grown food.
What services are available to producers? I think that there's a lot of opportunity available to producers in the sense of, particularly in Durham County, there's a lot of interest around local food. And so we have multiple farmers markets that are available, connecting back to this SNAP program. We have a double bucks program that's offered at all of the farmers markets that will essentially double the amount of SNAP dollars that folks want to spend, as well as WIC and Section 8 housing. And I think there's just, well, I'll say Durham County is starting a project. The county just closed on 129 acres in North Durham that will open up land for new and beginning farmers, particularly focused on BIPOC farmers. So we'll really be training up the next generation of farmers. As a lot of you probably know, our farmers are aging. I think the average age is in the 50s or the 60s. So we want to launch the next generation of farmers to help folks develop generational wealth and also kind of continue on those traditional knowledge of growing, using regenerative practices and traditional indigenous knowledge.
How many acres again?
129 acres.
Wow, congratulations. That's amazing. And you know, you're right about the number of aging farmers in this country. Bringing folks back into agriculture is not easy. And I'm wondering, you know, if you can just speak a bit about that and how we can make agriculture cool for people again.
Yeah, so getting into agriculture is difficult, not just because it's not cool, but the cost of land is very expensive. It's also not just the land, but once you get the land, then you need a lot of equipment sometimes. So having the resources, the funding to even just get seeds, get started, and then also that knowledge, particularly speaking from an indigenous person. We were cut off from our traditional foodways, and so like some of that knowledge has been lost over time, and so just knowing how to farm in a good way. But yeah, and then I think also coming from that indigenous, also sort of Black perspective, a lot of times our folks were told by family to like leave the farm.
Right.
It's not, you know, a lot of folks, even if you're formerly incarcerated, may have been forced to work on a farm while you were in incarceration. So there's a lot of trauma around farming.
Sure.
So beyond just like making it cool or not, like, you know, kind of really helping folks reconnect with the land and see the earth as a healing rather than a source of trauma.
Leah Penniman from Soulfire Farm talks so much about that, and it's so important. And Justine, if I can turn to you, I know you're working very closely with farmers. I just have to say that I'm so pleased Justine is here because Rafi is one of my favorite organizations in the entire world. So thank you for being here. You're working with churches to expand markets and access for Black and brown folks and indigenous farmers. How does that work, and why is that so important right here in North Carolina?
Thank you. Yeah, it's extremely important. We kind of serve as the connector and just the introductory piece, so we work closely with farmers across the Southeast, but in particular North Carolina, we work with a host of farmers of color. Mary, to your point, the resources that are available in North Carolina are like huge. Farming in North Carolina is a great place to farm because there's just so many nonprofits and service agencies available. There are people that even help you get access to NRCS and FSA and all of those pieces, Rafi being one of them, happen to know that piece. But we really think that churches and faith communities are in an amazing place to be in relationship with farmers.
Sure.
Relationships really matter, and the meaning behind that really matters. They are really interested in learning how they can support a farmer, but also just be more connected. And so a few years ago, the Come to the Table team started the Farm and Faith Partnerships Project, reached out to a handful of churches in Raleigh, and connected them with a few farmers of color in the Vance County, Wake County, Henderson area, and they just started what is typically called like a CSA share. I'm sure a lot of people will know community-supported agriculture, produce subscription, and it requires a lot of trust and a lot of vulnerability, especially for the farmer. And so what the goal is that we ask churches to really step into that vulnerability with farmers and be in that relationship and know that they pay ahead of time for the whole season or sometimes all 3 seasons. And you know, they kind of hope with them that the weather will be good,
Right.
that nothing will happen to the soil, that the gophers stay away, all of those sorts of things.
Hurricanes.
Hurricanes, I mean, yeah, the list is never ending, right? And so that move to just ask those folks that really value relationships, that value stories, that value being together, a group of people that come together at least once a week or more to eat together and be together, those are the folks that should be supporting those farmers and to really expand market access for that work. And we found that it's just beyond transactional. They want to be together, they want to share meals together, and they want to show up. And so it's been a really amazing journey to see that happen.
That's so awesome. That community building is so important. And Eric, that makes me want to turn to you. I'm wondering if you can talk about the Emmanuel Food Pantry, how it works with small farmers to source the fresh produce that is not often available at food banks, and how that distribution to folks who are clients, how that works and how it's been effective.
Well, there certainly isn't one solution to it. I mean, certainly our ultimate goal is to provide high-quality, nutritious food to our clients, or should I say our neighbors,
Right.
every week. And fresh produce and fruit is absolutely central to that. Unfortunately, produce is highly local because it's highly perishable, and it means we have to pursue multiple avenues. We have wonderful organizations like Farmers Food Share that work directly with North Carolina farmers and provide high-quality, locally grown food to us. It's not cheap. I mean, we need grants to make that happen.
You need infrastructure, right?
We need
too?
infrastructure. And then, we certainly make use of local wholesalers, local grocery stores. We've got another organization, Happy Dirt, which is a wholesaler of local organic, mostly organic, naturally grown produce. And again, with support from the county government, we have a grant to be able to get produce from them every week. And then, of course, we make use of grocery stores and the food banks in the area. Some of its produce is also sourced locally. We'd love to find more avenues. And then, of course, folks like myself, I'm going to be bringing a load of collards from my own garden to the pantry tomorrow. And we have lots of local farmers, including faith-based farming groups that bring produce to us every week.
Thank you so much, Eric. And this is a question for both you and Mary. So, Eric, you mentioned collards. There are lots of produce that is very culturally relevant, but people have forgotten how to cook these things, or how to grow them, how to cook them. How do you sort of re-educate folks who might? This is a question that I think about a lot. For people who might not have, a set of pots and pans, or working stoves or refrigerators that work in their own homes. How do you sort of overcome those obstacles to make sure that they can eat those things that their grandparents and their great-grandparents ate and loved and are so nutritious?
I think it's probably multiple strategies.
Right.
I'm just going to highlight, I don't know if Jasmine is here, but there's an organization called Eating Well, and they do a lot of cooking demos and food education around how to eat healthy foods, but in a cultural way.
Mm-hmm.
And they cook a lot of collards and lots of other things. So I think it's organizations like that are really meeting people where they are in the community to say, like, here's how you eat our culturally relevant foods, but let's cook them in maybe a slightly different way.
Right.
Thinking about folks that don't have equipment or may be unhoused. Just talking about Iglesia or the Emmanuel Food Pantry, I know that they actually make bags of food that folks can come pick up that are walking through. They have hundreds of drivers that come through, but they also, I think last time I heard, there are about 50 to 60 people each week that walk through. So they're giving them bags of food that they can carry rather than like big boxes.
Yeah.
But just thinking about, like, I guess from a food security perspective, like, how do we support people in getting access to maybe potentially canned foods or foods that are healthy to eat, but thinking about what people's circumstances are. So
Right.
it really is specific to every person. People think food security is like really simple, but I'm like, we're thinking about people's allergies. We're thinking about, are they unhoused? We're thinking about people's cooking skills, their eating preferences, like, you know, it's and also health.
Right.
So it gets really complicated.
Yeah, I think the short answer is it's definitely a dance, and it's definitely a community solution. So we have a large portion of Latinx coming through every week, but also African Americans, also African immigrants and other refugees, in addition to Caucasians, and widely varying diet. I would say that for me, one of the biggest challenges is, in terms of food education, is really general education around healthy foods as opposed to ultra-processed foods, which unfortunately way too many of our neighbors have been forced to eat, and in fact that is their normal diet. And so how do we now introduce them to collards that maybe their grandmother cooked but they haven't seen in their lifetime?
Right. It's such a huge challenge. Thank you both for that. Justine, if I can come back to you and talk about the role that churches and other religious institutions play in their communities. It's huge, and I've learned that over the years, especially around food and hunger. These are people who care deeply about hunger in the United States and around the world, but they're really doing a lot on advocating for better policies, like the White House is trying to instill, and so many Congress members like Jim McGovern and Shelley Pingree and others are trying to do. What role do churches play in that, and how does Rafi support them?
Sure. Well, what I like to say is churches are kind of doing this yes and kind of improvisation thing where, yes, they're meeting a lot of needs, and food is definitely something that churches, rural, urban, suburban, they've always been invested in and addressing. Food insecurity is a big one. Like I mentioned, churches hold stories. In the Christian tradition, food shows up a lot. And so they're often interpreting what that means for their actions and how they can be most involved. And so we often work with, so with the Come to the Table team, we kind of are a program, and we invite faith communities to participate in our workshops and trainings and conversations around how we might transition or shift from more charitable acts toward a more justice-centered approach. But we always do it in the sense that there's always, yes, you're going to continue to need to feed folks, right? So however, a lot of the folks that are in that work of feeding people and keeping pantries open, sometimes twice a week, it's very exhausting, and they need space to really process that and figure out how they can move on. And so we try to offer kind of a yes and allow them to kind of express and say what they're feeling, create peer connections across the state, and learn from other clergy and faith leaders who are also doing this work. And also, what are ways that we can step into advocating for stronger policies that would improve SNAP and WIC access? How could we expand, school meals so that the burden isn't always on churches or isn't always on 1 to 2 players to feed children and families? And so really, we kind of create this container to have those conversations, and then also provide them the resources. Like, hey, have you seen our Farm Bill platform? You can kind of see it here. Or have you seen NSAC's Farm Bill platform? Whatever it is, we kind of try to make the dots and connect them so that they can continue to do both things, which are both really hard to do. But operating in that space of safety and finding a way to do both of those things.
Yeah, that yes and approach and connecting the dots is all we've been hearing, and I think that's so important. Norbert, if I can come back to you, Justine talked about a justice-centered approach, and we know that programs like SNAP are critical. They are vitally important in this country, but they don't and they can't solve all of the inequalities that we are seeing in the U.S. right now. What other kinds of solutions are out there, and how can we lift them up?
Yeah, thank you. And I want to make a really clear point about the inequity when we look at food insecurity. If you look at the national statistics of food insecurity in the United States, you will see that certain households are much more likely to be food insecure. African American and Hispanic households led by single mothers, particularly, and even with single fathers. And so there's something that's not right about that. You can just look at that, and that doesn't make sense. And so it represents this larger problem that I think is happening in our society. SNAP is a critical program. It really does reduce food insecurity. There are a number of studies that actually show this in a causal relationship. However, when you peer behind those studies and you start to look at what inequalities still remain even with SNAP, those inequalities persist. And so there can be ways of thinking about how do we adjust the SNAP program to actually make it more likely to not only lower food insecurity, but also reduce the disparities in food insecurity. But we can't just look at a program like SNAP and say, well, that's all that needs to take place. Because at the root of food insecurity is economic instability or inequalities. And so thinking about what are the larger set of policies that we can implement that can help address those issues is critical. We should never forget about taking care of the food challenge that families face. But if we're not also thinking about the economic opportunities for those families, we're going to continue doing this effort. And we're never going to get to those root causes. And so I do hope that we can continue this conversation about food, but I hope we can bring other partners in to talk about what does it mean for housing? What does it mean for employment opportunities? And how can we work collaboratively? It's messy, and it's not always easy, and it's costly, but it's worth it because the cost of not doing it is actually, I believe, greater. So I would hope that we can have this sort of multiple-pronged approach to address these issues of food insecurity.
It's so needed, and you're right, it's messy. One of my good friends is Adrienne Lipscomb from the 40 Acres Project, and she is not just a chef, but also a city planner. We need more folks with like multidisciplinary skills to come into these conversations and really help, unpack that messiness, dive into it, and embrace it in so many ways, right? Well, I want to come back to you because I'm scared, okay? We saw the expansion of the child tax credit and how successful it was for reducing childhood hunger rates during the pandemic. And I'm wondering what support you see for it, for making it bigger, better, more expanded, because we have a really difficult political situation in this country right now.
Yeah, no, it's a great question, and I think Norbert just touched on a lot of really important points around eliminating disparities in this work as well. The child tax credit, when that was implemented through the American Rescue Plan in 2021, we saw child poverty be reduced by nearly 50%, and that was across demographics as well. We also saw food insecurity drop by 26% as a result. And Norbert was just hitting on all the right points about the need to both address poverty but also create economic opportunity. And so the child tax credit and both the expanded child tax credit and the earned income tax credit we know are proven tools to be able to both reduce poverty and address food insecurity, which is why the Biden-Harris administration continues to push for a permanent expanded child tax credit. That's a continued conversation that was actually in the national strategy as well, and something that the president continues to speak to the need of, and in addition to so many other areas. Again, not to belabor it, but the summer EBT program is really a huge opportunity, and again, we want to continue to work with the states that have not taken the opportunity from that program to make sure that this truly reaches all of the children and families that could be impacted and could benefit across all 50 states. And then also, I think I forgot to mention as well the important work that USDA has done around the community eligibility provision to they introduced a final rule that allowed for close to 3,000 additional school districts to be able to provide healthy meals, healthy school meals at no cost to families as well. So this is important continued work to both address poverty, which is one of the root causes of hunger, while also ensuring that as we're doing that work, that the food and the benefits that are being provided allow for nutritious, healthy food for these families as well.
Absolutely. We're almost out of time, but I'm going to have us go 2 minutes longer because I want everyone on this panel to give a 30-second call to action. Mary, can I start with you?
And is this call to action for?
Call to action based on the work that you do. What do you want to see happen over the next, let's say, 4 years? Let's keep it,
My big thing is I would say that the federal government really needs to take a look at subsidies. We currently subsidize commodity crops, essentially corn, soybeans, things that are going to corn-based ethanol, so fueling our cars, corn-based feed that are going to factory animal farms that are contributing to climate change, and ultra-processed foods. While at the same time, the government is spending millions and billions of dollars on public health programs to help people make the healthy option the easy option. So if we changed our subsidies, instead of making the commodity crops cheaper and subsidize fruits and vegetables, which the government considers specialty crops, and making those cheaper, our families would be able to afford those healthier options. So yeah, that's my.
I love it. Thank you so much, Eric.
Everything you said. And, just week in, week out, our goal is for our food insecure neighbors, provide food, provide healthy, nutritious food, provide culturally appropriate food. And to do so takes money and it takes creativity. As mentioned earlier, there are ways we can bring this together. We can do those things and address important facets of climate change, important facets of food waste, Norbert brought up earlier, important facets of, good nutritious food means healthy minds. It means, better learning, on and on and on.
Thank you, Eric. Will?
Yeah, and we touched on many of these pieces. Obviously, we're very focused on implementing the national strategy on hunger, nutrition, health, but it goes without saying we're at an important moment right now to be able to protect the programs that we've spoken about that do help to eliminate hunger and do help families in need. And so would just, again, for those here that are able to just continue to educate the folks in your communities about the importance of fully funding the WIC program, the importance in the states that haven't taken on the summer EBT program to look at taking on and applying for that program in 2025. The importance of permanently expanding the child tax credit and earned income tax credit that President Biden was able to accomplish, the American Rescue Plan. Those are all critical, and those are all discussions that are ongoing right now, and so just want to lift those up again as important here and now opportunities and policy issues that would be helpful for folks to continue to educate your communities.
Absolutely, thank you, Justine.
So my call to action would be for faith communities, particularly in North Carolina, where we are losing farmland at an alarming rate toward development. Think about their assets and what they have, especially land, and how faith communities can participate in the food system in different ways. I would love to see protection of land that any faith community might own, and really know that is it's actually not theirs. They believe that it's God's, and so how can we share it and make sure that it's available for protection and also protecting future farming generations?
Thank you so much. Norbert, my friend, you get the last word on this panel.
All right, well, thank you. I have a couple of last words, but I'll be quick. One, to the research community, this is important work. We should value it, and we should continue to do the really thoughtful scientific work that we can do and make sure it gets out to the larger community. Because I'm a faculty member, I want to encourage our students, and I know there are students in this audience. This is valuable work, engaging in issues of food security and realizing it's part of the larger issue of climate and the larger issues of social inequalities. These are ways that you can make a difference, and I just encourage you to continue to do the work that you're doing, because I'm not going to be able to do it for much longer, and I want to make sure others come along. So thank you.
Thank you, Norbert. Thank you to all of the panelists. Big round of applause. I'm really so glad that Norbert brought up the need for thoughtful scientific work. That is going to be much needed, and science has been attacked in so many ways over the last several years, so keeping that in mind is really important. It is now my incredible honor to introduce U.S. Congressmember Valerie Foushee, who represents North Carolina's 4th Congressional District. And so we're so excited to have her and her voice here. So please give her a round of applause as she joins the stage. Thank you so much for being here. It should be turned on. Another round of applause, please. So thank you for joining us again. I'm wondering if we can talk about something that was sort of mentioned in the last panel, and that's the need for different kinds of infrastructure to connect eaters with food markets and local growers.
Sure. First of all, thank you for having me here and certainly allowing me to be a part of this very important conversation. Yes, it's good to talk about this situation holistically, and I think part of that is talking about infrastructure and about ways of not just moving people from point A to point B, but ensuring people have access to services,
Right.
access to all of those things that are needed for them to be able to raise healthy and providing nutrition for their families. So I'm proud that there has been, from the federal government through the Biden-Harris administration, funding coming directly to the 4th District, particularly as it relates to providing more funding for buses and for the rail system.
Sure.
We know that over the past few months, there has been $2.1 million invested right here for expanded access to bus services. And I think we all saw the announcement where $1 billion has been invested right here for the Raleigh to Richmond S-Line rail service. So glad to see those kinds of things happening and understanding that we take the opportunity now to provide transportation so that people are connected with the services that they need.
Because so many folks are living very far away from farmers markets or grocery stores.
Sure.
Buses are, I'm hoping you can touch a little bit more on that. Buses are so important. And for those of, the folks in the audience who drive cars and get around that way, buses are vital. Can you talk a little bit more about that?
For several reasons. First of all, we know that we need to do what we can to reduce the effects of climate change. And so we're talking about relieving congestion. We're talking about easy access, cleaner access,
Right.
Safer access, all of those. And I mean, they're important. We see, particularly in a growing area, where we're trying to remove as many combustible engines off the roadways. Just allowing for people to have access without the need for putting more cars on the road is the way that we should be going, and providing that funding allows us to do so.
So important. I want to shift gears a little bit and talk about the role that green spaces play in improving the overall health of communities. We've talked about whole person, holistic health. Green spaces are a huge part of that.
Absolutely. Because if we're talking holistically, we want people to be healthy. And so we have to allow for those spaces to be available by way of parks and other areas of green space so that people can move. People can have access to recreation. When we also talk about green spaces, we're talking about reducing other factors that contribute to climate change.
Right.
We take these opportunities to reduce pollution and have those green spaces in centers where people can access them. Again, if you connect green spaces with access to transportation so that people can get to these areas, have the opportunity to explore parks, explore nature, add to what we know to be a thriving ecosystem. All of that is important.
And so important for children.
Absolutely.
Absolutely.
And for seniors like myself,
Barely.
we still want to move.
Not at all, not at all. I'm wondering what opportunities you're seeing right now as such an influential member of Congress to improve food security at the national level before November.
Yeah, so I'm glad that, how about that one? I'm glad to have heard some of the conversation with the earlier panel, because I think, particularly since the pandemic, we've seen how the federal government did come in and provide nutrition for not just people who didn't have access by way of transportation or being able to get out, but with school children not having access to be in school buildings where many students who live in poverty were relying on meals. They were getting meals for breakfast, getting lunch, and many of them leaving school buildings with backpacks with food. But that whole situation that was funded by the American Rescue Program, where for a long period of time, people became reliant on access to those meals. It gave the opportunity for not just children, but also senior adults, people who had not engaged the system before, had the opportunity to be provided with nutritious meals. I think we know that there is a responsibility that government plays in ensuring that there is food security. I think we learned a lot of lessons from that. It is my hope that we would continue all of those programs that provided for nutrition for children and their families. It's interesting that a number of situations were revealed during the pandemic, such that there was a greater push to not just acknowledge that this was a situation, but to provide for it, and to come together in a bipartisan way to provide those funds. It's not like when the pandemic ends, people went back to having opportunities for job placement and that sort of thing. It's not such that people were able to move back into what they knew to be normal. So to just stop, have a dead point where no longer these programs were available does not make a whole lot of sense. And so I'm hoping that my colleagues will move forward with understanding that until we get to a point where people can count on assistance as it relates to our farmers, particularly new farmers, farmers who saw a period of time where they could not invest in equipment, as we heard earlier, or understanding what the supply chain situation yielded for all of us. Our role as a responsible government is to not only see those things, but to address them such that we can move our country forward.
As somebody who is an anti-hunger advocate and understands the lessons that we learned from the pandemic, and to be frank, not a lot of your colleagues are remembering those lessons.
Sure.
Do you feel optimistic that we can make these changes and make them quickly enough so this the generation of kids right now who are struggling, the generation of families right now who are struggling, that they won't have to 6 months from now, 2 years from now, 4 years from now?
That's a really tough question. I want to be positive about it, but I think all of you, there's no one in this room who has not watched and has seen that there is gridlock in Congress. But I do believe that there, by and large, is a sense among most folk in Congress that we are at a critical point where it is our responsibility to provide. I'm hoping that when we return this week and we talk about providing appropriations for government such that our country functions, that we'll put these issues front and center, that we understand that people are not just wanting to see, but people need to see us address their needs, and particularly as it relates to poverty and nutrition, particularly where it relates to housing, as you heard earlier, and particularly as it relates to helping people to understand how you build wealth.
Right.
In such a manner that when situations come that don't allow us to function as we normally have, that there are reserves.
Right.
Not only personally, but that the government has reserves that come in and provide what people need.
Those safety
at
nets.
a time of need. Those safety nets.
So important. You know, you mentioned poverty and poor nutrition go hand in hand. Safety nets are critical. You're a co-sponsor of extending WIC for New Moms Act, and I'm wondering if you can talk about that, and again, why it's so important.
Interesting. I didn't know about WIC until I had my own children. And seeing what WIC does for women and infants and children, particularly children up to age 5, providing that necessary nutrition so that they have healthy starts is critical. We know that children don't perform well when they're hungry.
Right.
None of us do. But for children who are developing, to not have access to nutrition makes no sense. What expanded WIC does is to provide for moms and children to have access to these resources for a longer period of time, from 6 months to 12 months. And for women who are breastfeeding to extend that period of time from 12 months to 24 months, such that we know that we're providing healthy starts by way of nutrition for young children and for the moms. Because WIC not only provides those resources, but also those safety net resources become available to those moms, those infants, and those children.
It's such common sense legislation and programming, and
Absolutely.
I don't know who could be against it.
No.
I
One should think that.
You are also a member of the Hunger Caucus in Congress, and I'm wondering what are some of the caucus's big goals right now?
So, and I want to say, so that all of you know that, because I'd like for us to think of things in bipartisan fashion. Certainly, we are indebted to the Biden-Harris administration for how it did bring us through the pandemic and what those pieces of legislation by way of the IRA, the IIJA, the Investments in Infrastructure Jobs Act, all of those pieces of legislation that has brought us to this point. But that caucus is a bipartisan caucus where Republicans and Dems come together to talk about this issue, and this issue in particular, because hungry people are Democrats, hungry people are Republicans, hungry people are people who are not affiliated to any particular party. So it is our goal to make sure that we are pushing forward by way of the Farm Bill, by way of other pieces of legislation to make sure that we are addressing the needs of the American people. One of the things that we spent a lot of time talking about is what we do for farmers. And understanding how important it is that we equip farmers to provide the food stuffs that we need. So it's a good place to be.
It is a good place to be, and we talked about farmers and the aging population of farmers in a previous panel. What do you see as most successful in helping Black and brown farmers, indigenous farmers, those young farmers who want to get into this but are facing so many obstacles, whether it's student loan debt or lack of health care? How can the federal government, how can the state government, I mean, from your perspective, help those farmers really succeed?
Well, I think, first of all, having acknowledged how difficult it is, that the federal government should be in position to provide funding, whether it's by low-cost loans or for grants that allow for farmers to be successful in purchasing equipment and those other necessary things for successful farming. In addition to that, it seems to me that we need to continue to fund land-grant universities, particularly like here in North Carolina A&T State University and North Carolina State University that has these extension programs that help our farmers with their needs, understanding that there is a place where they can go for, I sat in on a session that talked about what regenerative practices are for farmers, and where, as we heard from our Native Americans, that these are things that were done decades and centuries ago.
Right.
And now they're fancy to do.
Sure. They're not new.
They're necessary to do. They've always been necessary. And to have these institutions to come out and help our farmers to understand that these are ways that they can be more successful, that's a role that the government can play and should play. And I'm happy to know that we are doing it to a good extent, but we need to do more, and we can do more.
I'm so excited that you're here because you're such an advocate for farmers and you're an advocate for solving the climate crisis. Farmers are on the front lines of the climate crisis right now. What needs to happen for them here in North Carolina?
Well, again, if we're addressing climate change in such a manner that farmers know that we hear them when they say that if we go through serious droughts, we have trouble. If we're going through floods, we have trouble. To be in position where we are addressing the climate change needs, but also as it relates to preparing farmers to do other things in those situations,
right.
such that in the interim, that they're still successful, that there are other ways of putting forward that product, making sure that we are assisting in ensuring that they can get products out, that in the meantime they're doing other things that allow them to be successful until those times that we return to situations where we're not in droughts and we're not in extended heat periods.
Thank you for that. I'm wondering, Congresswoman, you know, I think a lot about this idea of citizen eaters, people who vote on behalf of farmers, on the food system, who vote for climate resilience. How do we get more candidates like you in office?
So, I think what we have to do is pay attention to who is representing us, and to understand that, let me just say this, I believe that most people who come to public life come because they want to help. Somewhere along the way, we get distracted. But it is incumbent upon all of us to look at who is standing before us and what they're saying about what they will do for us. A lot of that has to do with making sure that people who come to state government, people who come to Congress, have the political will to stand up for everyday citizens. And somebody has asked me, what do you mean by everyday citizens? I mean all of us, that no one of us carries a greater weight than any other of us. It's the same way in a legislative body. If there are 50 of us, then all 50 of us carry the same weight. Well, it should be the same for the American people, that we don't just cater to people who have the loudest voices, but understanding that each of us represents a number of people. I grew up very poor in this area, but through education and persistence of my parents, who were teenagers when I was born, but they understood the value of hard work, so they worked more than one job.
Sure.
They understood the value of education, and so they made sure I got one. And they understood faith, and they made sure that it was pushed into me such that I came here from church today. These are things that I think you should be looking at people who want to represent you. Do they share the same values that you share? And if you look at what they have done, if they have any kind of record at all, look at what they've done and for whom they've done it. If they don't have a political record, but you haven't seen them in your community, whether it's PTA or some festival where you saw them at the table working rather than just enjoying the benefits of that, look at those folk who you can genuinely see a desire within them to ascend themselves beyond themselves for somebody else than themselves. Those are the kinds of people we should be sending to represent us in any legislative body.
I'm sorry, I'm emotional. You made me cry. We are at the end of our conversation. Thank you for your courage. Thank you for your inspiration. Thank you for your service. It's been wonderful to have you. Round of applause, please. I always say it's not a food tank summit if I don't cry on stage. We're going to turn to our next panel to explore the importance of healthier food environments. I'd like to welcome our speakers, Kellyanne Blazek, the Special Assistant to the President for Agriculture and Rural Policy in the White House, Chef Rob Kineen, a native Alaskan chef and the Outreach Director for the North American Traditional Indigenous Food Systems, also known as NATIVS, Alice Ammerman, a professor in the Department of Nutrition at the Gillings School of Global Public Health and the director of the Center for Health Promotion and Disease Prevention at UNC Chapel Hill. Such a mouthful, Alice. And Gavit Fitzsimmons, a professor of marketing and psychology at the Duke Fuqua, did I pronounce that okay? School of Business. Give them a round of applause, please. Nice to see you. Kellyanne, I'm going to start with you, okay? The Biden-Harris administration's national strategy on hunger, nutrition, and health prioritizes healthier food environments. And I'm wondering, to help set the stage for this conversation, what is a healthier food environment? What's a food environment?
Thanks, Danny. Great to be with you all today. As Danny mentioned in the national strategy, Pillar 3 is all about healthier food environments. And that means anywhere there are people, we need to make sure that the healthier option is the easy option, as our previous panelist mentioned. And so that really starts with kids. That starts in schools. And maybe we'll do a little bit of audience polling. Raise your hand if you ate school meals when you were growing up. Okay, for those on the live stream, most folks in the room just raise their hand. There's actually 30 million kids who eat school meals every day. And so it's a huge reach. And one of the things that we're really focused on in the Biden-Harris administration is making sure that there are healthier food options in schools. USDA issued a proposed rule around healthier food options in schools to make sure that school meals, nutrition standards in school meals are actually aligned with the US dietary guidelines. That rule will be finalized this spring, and one of the pieces that I'm most excited about is what would be the first ever added sugar limit in that proposed rule. We know that kids are consuming way too much added sugar, as are a lot of us, but that's kind of baked in, no pun intended, but baked into the food system, right? So it's not like people are adding sugar at home. Same for sodium. We're not adding sodium at home, which is baked into processed foods. And so we understand that we can't flip a switch and turn this on or off overnight. This has to be incremental progress. So the proposed rule would actually phase in an added sugar limit over time. That would do two things. One, it would give manufacturers time to actually reformulate their products. And two, it would give kids time to have their palates adjust to those new foods. So that's just one of the actions that we're taking to create a healthier food environment.
Thank you for helping explain all that. It's so important to really set the stage. Chef Rob, I want to turn to you. Kellyanne mentioned kids and young folks. we have really learned that young folks not only need healthy foods, but they need those culturally relevant options. And I'm wondering if you can explain how Natives works with tribal colleges to get more traditional foods, more culturally relevant foods, sorry, I'm coughing, into those dining halls.
For the past, well, actually, I just got back from Minneapolis last week where we put together 20 meal plans, basically menus for the Red Cloud School in Pine Ridge, South Dakota. We're also working with, so backing up, the recipes that we did were culturally relevant for Pine Ridge and the Plains area.
Right.
And they were also, Natives has got a pre-contact food philosophy. So if you were to dine at Awamni, the restaurant that is now owned by Natives in Minneapolis, Minnesota, which is award-winning, you would actually have no beef, pork, or chicken, no flour, no refined sugar, no dairy.
Right.
If you walk into this hustling restaurant that's been sold out for 3 years and there's no dairy.
I've eaten there, it's amazing.
Yeah, and so I think you back up and you say, well, what is there? You know, there's bison, there's turkey, there's crickets, there's lake fish, there's Three Sisters, there's a lot of indigenous foods, nixtamalization of corn. So while that's not from the Great Lakes region, but we're kind of borrowing from our brothers and sisters.
Right.
So we're taking those food philosophies and we're integrating them into the food program with Red Cloud School, and then we're actually in infant. We're in some steps right now with another bigger national entity that works with tribal schools. So we're actually going to start kind of working with an institutional model, and again, not only are we bringing culturally relevant foods to institutional landscapes, that we're also creating, I think what will happen is opening up dialogue for those indigenous farmers that are producing those indigenous foods to start growing their worth by having those foods available on bigger corporate dining entities like like a Cisco or a US Foods.
And you've talked to me about the importance of contracts with those food producers, those foragers, to make sure that they have sort of a long-term security to be able to do that. Can you talk about more about why that's important?
I think a really great point of view on this is that we're working with the USDA FDPIR, Food Distribution Program for Indian Reservations. So when you think of indigenous food, there's a commodity food box that's a part of that program, right? That box serves as the identity of Turtle Island, which is from Florida to Maine to California to Alaska. And I give you a box that represents that food.
Right.
That doesn't really seem right.
Right.
So I know one of the things that we're looking at is, we talk about constantly, is regionalizing that box of food. So, people in Alaska don't care about napoles.
Sure.
People in Florida, probably don't really care about salmon. So it's just kind of like, what can we do to kind of regionalize that food? But what that will also do is integrate regional food systems. Breaking that up into a regional facet will also create regional demand for those traditional foods for a culturally relevant client base.
And yeah, it's so important to think about food systems more regionally rather than the way we've been thinking about them for so long. Thank you for all of that. Gavin, if I can turn to you and shift gears a little bit, I want to talk about this definition of healthy. We throw this term around a lot, but the definition doesn't regularly change for companies. And I'm wondering, how do we balance the need for consensus while also recognizing that health and nutrition research will continue to evolve, will continue to learn new things?
So I think I might be one of the few sort of representatives of the business community here today.
Others.
There's a couple out here. I spend a lot of time partnering with big businesses, and many of them are shocking. It might shock many in the room. Very interested in providing healthier foods to their consumers. Not surprisingly, because they see it as a profit incentive. All right, I'm a business school professor. I don't think that's a bad thing. I think that we should not shy away from the profit incentive as a way to get healthier foods into our children's diets. The challenge that I hear over and over again from the big food service providers and the manufacturers and the retailers are that they feel like the goalposts keep changing. And so, if we go back 5 years ago, it was fat, and we go back, then it was salt, and now, no offense, it's added sugar, and and they're trying to develop products, which takes in some cases years, that meet the needs of the consumer, and yet it's really, really difficult. Allison, her team of researchers are working away and coming out with really cool science on what is healthy, but I think it's really hard for these big companies to, and I'm not crying a river for them, okay? But they find it difficult. For example, I work with a very large food service provider. They do 8 million meals to children every day in America. They have a team of about 45 chefs and researchers that are working literally flat out to develop healthier foods for kids. Why? Because if they are healthier than the other food service providers, what's going to happen? They're going to get more contracts, make more money. In my mind, this is a good thing. That's why I partner with them and provide advice for nothing, because I think it's a good thing. And yet, their guys say to me, well, added sugar, nobody used to stress about. Now we're stressing about added sugar. What's it going to be next year? And I think it would be incredibly helpful if we could, as a community, communicate whatever that might be, right? So again, not crying a river on their part, but I would like to suggest to those of folks out here, and we've heard a lot of folks in government doing amazing work, a lot of folks like Rob doing really entrepreneurial stuff in the community. This is amazing. There's a resource in these giant Fortune 500 companies and unlimited amounts of money that could be put to work in this domain if we can just basically tell them what is it that consumers are going to want so that they can make it, they can make their money, and our kids can eat healthier.
Again, it's about that communication, connecting the dots. Thank you so much for bringing that up. Alice, if I can turn to you, Gavin talked about meeting the needs of eaters or consumers, and one of your areas of interest is around medically tailored meals. And I'm wondering if you can talk about what these meals are and how they help eaters access more nutritious food at home, especially for, I imagine, elderly people, people who are sick. Can you talk more about that?
Yes, I think we have a lot of opportunity coming with the medically tailored meals. Food is medicine. You'll be hearing about that in the next panel, I think. And just a lot of efforts to try to make food, healthy food, more accessible. We haven't said much so far about the fact that food needs to taste good for people to eat it. And it needs to be culturally relevant. That's often a big part of taste. I started a little company that makes healthy frozen meals, and our favorite compliment is when people say it doesn't even taste healthy. So it's a little sad, but it kind of conveys the fact that people have this assumption that healthy food tastes bad. So we need to work, and if people aren't going to be eating the food that companies are trying to make to be healthier, then it's not going to work economically, so we have to do that. So the medically tailored meals, it's a way to try to reach people who may not have access to healthier options, may not have tried some things that could fit into their culture. We have the 1115 waiver in North Carolina, a really important thing that's giving us the opportunity to use Medicaid dollars to fund medically tailored meals, medically tailored groceries, and being able to get that to people who are in need and hopefully then encourage them to adopt some of those ways of eating.
Thank you so much, and thanks for bringing up the deliciousness point. I want to come back to you in a minute, but Kellyanne, I think Alice brings up some interesting points, especially around some of the efforts that are underway for school meals and ways to make them more nutritious and delicious. Can you talk a little bit more about that?
Yeah, absolutely. One of the things I love about coming to food tank convenings is everyone has so much passion for these issues, but everyone's food story is a little bit different, right? So everyone has a relationship with food. My relationship with food started on my family's farm. I'm from rural Wisconsin. We grew up raising beef cattle, and so I've seen firsthand how the the local food economy can really open doors for local farmers who are looking for new markets. And one of the things that we're proud of doing at USDA in this administration is trying to connect the dots between local food producers and schools. And obviously we have the Farm to School program, which is really helpful, but we actually invested $200 million in cooperative agreements between USDA and states, tribes, and territories to help them enter into agreements with local producers to get that food into schools with a specific target for underserved and small producers. So this is really a win-win-win. It's a win for local producers who are looking for new markets. It's a win for making sure there's culturally relevant foods in schools. And it's a win for kids who are looking for delicious, healthy, local foods. And so we're really proud of that investment.
Thank you so much. Gavin, keeping sort of on this theme of kids and making food environments better for them, are there strategies that stand out for you that encourage young eaters to consume healthy food?
Sure. Maybe if I can take 10 seconds to just comment on something that Kellyanne and Alice raised. One kind of fun thing that we've been finding is we've been highlighting in our communications to consumers that foods are local by saying where they're from and et cetera. And it turns out when people find out that the food is locally grown or raised, they think it's both delicious and healthy. So it breaks that cycle, that ugly cycle that many of us have learned over the years. So that's kind of a fun thing for it. Hopefully, so focus, highlight local. It's really awesome. Some of the sort of the things that we do with children to try to motivate them to make healthier choices, it's not rocket science. It's basic motivation and trying to encourage them. We ran a test program with a school district in Western North Carolina, 6 or 7 schools in partnership with a big organization. We called it the Fruit and Veggie Challenge. We gave the kids stickers for every additional serving of fruits and vegetables that they consumed at lunch. They had each class then put the stickers up, and they had a competition for who had the most stickers at the end of the Fruit and Veggie Challenge, and then the class that won a prize. It was not a pizza party, and those kids then learned for a week that fruits and vegetables can be interesting and fun and rewarding. And then we tracked fruit and vegetable consumption over the coming weeks, and lo and behold, they ate more fruits and vegetables, even when there were no stickers, when there was no incentive. It was heightened if we got parents involved at home. And so that's not anything fancy. It's just trying to give the kids something that rewards them, that encourages them to try some things. When they find they like them, they respond really positively.
Again, it's common sense. It's not rocket science, right? It's so interesting to me. Chef Rob and Alice, I want to turn to you because I think a big part of what we're talking about when we talked about local, we're talking about healthy foods. We need to procure those things in such a way that is beneficial for farmers. And Chef Rob, we heard about the trauma of some indigenous folks or Black and brown folks going back to farming that their grandparents might have done. How do we encourage a procurement system that emphasizes culturally relevant foods in those regional food systems that you mentioned before?
Yikes.
Sorry.
No, that's a big one. But I think that's, again, going back to something like a model like the FDPIR program, Food Distribution Program for Indian Reservations. I think that, what I love so much about working with natives and working with Sean, he's very eloquent in the way he can talk about the history and trauma of indigenous people in this country and bring it without being abrasive or confrontational. It's just very matter of fact.
Right.
And I think that part of it is really understanding that dialogue so we understand why the indigenous food system is the way it is today. But to rebuild it, I think that, with a good example is the FDPIR program. Something that goes into that box that represents food for an indigenous community should be contractually obligated to come from a BIPOC or indigenous farmer producer. And if the means aren't there to get that, then there should be funding available to solidify that base. A good example, I know that people are interested in bison, and but when you look at the bison, what the FDPIR box needs to produce a pound of bison for 550 confederated tribes across the country, there's no indigenous producer that can do that. So then it goes to a non-indigenous purveyor. There should be a preference, with the 638A Self-Determination Act, for example. There's a lot of different ways that we can kind of leverage that information and bring it to, but also I think there needs to be an understanding of why that is the case. And I don't want to get into all that right now, but I would say that I think those dialogues need to come out as well.
I think Sean
in a proactive fashion.
I think Sean will bring up some of that later too. So thank you for that. And sorry for such a complex question, but you answered it so eloquently and so matter-of-factly. I really appreciate it.
Danny,
Alice.
sorry, can I jump in on that just real
course.
quickly? I just wanted to mention, since you brought up bison in the FDPIR program, we do have a pilot that we launched specifically around trying to address the challenges that Rob mentioned. In terms of like the quantity that's needed to have USDA purchase bison, et cetera. The pilot is ongoing right now, but essentially it allows USDA to purchase smaller portions of bison directly from tribal producers, and also allows them to use local distribution to get it directly to tribal nations. So a lot of times in government programs, when we're trying to figure something out, we do it in a pilot fashion to see how it works. But we're really looking forward to seeing how that plays out and how we can work in partnership with the tribes. Obviously, tribal self-determination is a key cornerstone of this administration, this president, so we're really committed to figuring it out.
Thank you. Thank you both for that. Alice, the procurement process for your medically tailored meals and these delicious frozen foods that people don't know are healthy, how does that work?
Well, one approach is just to emphasize what foods are locally available and using that in recipes and school meals and things like that. So like sweet potatoes, that's our state vegetable, if anybody didn't know that. They're wonderful because they last a long time. They're pretty inexpensive. So we use those in almost every meal. My research hat, I studied the Mediterranean diet and how it affects health. And I think a lot of people have the misconception that if you eat a Mediterranean diet, you have to eat grape leaves and olives primarily. But the nice thing is that it's really the science behind the Mediterranean diet, which is that transition that Gavin talked about, of now we're looking at healthier, good quality oils that you tend to find in Mediterranean kind of foods, and then the usual kind of fruits and vegetables, nuts and things. So we've adapted what we call the Med-South diet, which is taking the Mediterranean diet and applying it to the kinds of foods that people are more used to eating here. And to take that to an extreme, I work with some folks in Kenya who, you may know that a lot of low and middle income countries, they're finding they're developing the same chronic disease rates that we are here because unfortunately a lot of it shipping our own eating practices and ultra-processed foods over there. And it didn't take very much to look at their recipes and say, how about a little bit more of this, put some of this here. It turns out they use a lot of collard greens, just like we do here in the South. So there are a lot of ways to culturally adapt the science of the Mediterranean diet into healthier and culturally relevant foods.
I'm so glad that that's finally coming about because I know that the Mediterranean diet has been applauded as the only, we should all be eating that way, but to recognize that it doesn't look the same. These culturally relevant diets look different almost everywhere. We only have a few minutes left, so I want you all to sort of answer briefly, if you can, the role that the private sector plays in supporting the creation of healthier food environments. And so maybe, Gavin, if I can start with you.
I think it's underutilized right now.
Yeah.
And I think there's an opportunity, if you think about how, getting something passed through our government right now has already been mentioned. Gridlock is tough and it's very hard to get things to be implemented. If a very large company thinks they can increase their profits by rolling out healthier food to our children nationally, it'll happen next week. And so I think there's a huge opportunity for us there and some of it is, in demonstrating through entrepreneurial activities like the kind of stuff that Rob's describing, just how it can work. And then those big companies can learn and leverage that and roll it out on a mass scale. And so, look to them for opportunities.
Thank you so much. Kellyanne.
Yeah, it's absolutely integral to the success of a lot of the policies we're working on through the federal government. So school meals is a great example. We can push policies and rulemakings that advance higher nutrition standards for school meals, but unless the products exist in the marketplace, it's hard to implement for schools, right? If there's no products to buy, it's easy for them to push back and say, not feasible, the market's not ready yet. And so through the White House Challenge to End Hunger and Build Healthy Communities that my colleague Will mentioned earlier, one of our focus areas was trying to partner with the private sector to cultivate commitments around healthier food products and reformulating food products. And one of the commitments that we highlighted last week was one from the International Dairy Foods Association, which is committing to lowering added sugar in school milk. And so that will directly support the rulemaking that we're working on to ensure that healthier products get in schools.
Why is there sugar in milk, Kellyanne? That's a whole other discussion. Alice, if I can turn to you.
But one reminder is the private sector isn't just large corporations like Chef Rob. Farmers are in the private sector. So, and it's not a bad thing to make money. People in rural areas need opportunities to make money. So if we can support local businesses that serve people in the community and also, it sustains them economically, that's all really important. So entrepreneurial efforts can be very broad and are really important to economic development.
Fantastic, thank you. Chef Rob.
I guess echoing a lot of it, I would agree. I know that I'm working with, a large national food corporation, and they're not doing that because they want to feel warm inside. They're doing it because we know that they can use our information, our intellectual knowledge to create a recipe that will create demand, that will create more clients and customers. Health happens to be a byproduct of that situation, in my opinion. So I have to also understand, I feel as if I need to know where I am in this situation. And then I will say I got to cater the White House Tribal Nations Summit this year in DC, and it was actually really exciting to hear a lot of the advances going on with this administration regarding the red tape of, for example, USDA processing facilities on tribal nations, because if your land is in trust, you cannot leverage it to get a USDA approved bison processing facility. So what are we going to do about that? How can we do that? How can we do that and move forward? And that's, so that is being addressed, and I do appreciate that. And so, I don't know, it's kind of a little bit of a mixed bag there as far as things to do.
Sure, there is progress, but there needs to be more. Yeah. Please give a round of applause to all of our panelists. Thank you all so much. In the lead up to today's event, we reached out to all members of Congress in the House and the Senate who represent North Carolina, asking them to share remarks for the summit. Not everyone was able to record in time, but I am grateful that we are able to share a collection of these videos with you throughout the afternoon. So I'm excited to introduce the first two of these videos submitted by U.S. Congressmember Dr. Greg Murphy of North Carolina's 3rd Congressional District and U.S. Congresswoman Alma S. Adams representing the state's 12th Congressional District. While the videos play, I'd like to invite my friend Luis Guardia, the president of the Food Research and Action Center, to join me on stage for our next fireside chat. Enjoy the videos.
Good afternoon, everyone. I'm Dr. Greg Murphy. I'm a member of Congress representing North Carolina's 3rd Congressional District. I'm very grateful for your efforts to emphasize the close relationship that occurs between food and medicine. I've been a physician now for over 30 years, and I understand the impact that nutrition has on the health, well-being, and recovery of my patients. We all understand that obesity and chronic disease is oftentimes a result of poor food choices, driven by inadequate education, ultra-processed foods, and lack of access to fruits and vegetables. We must push for comprehensive reforms of SNAP that ensure recipients choose nutritious and healthy food alternatives. Prescriptions are often not needed when individuals treat food as medicine. With your dedication, we can make progress in expanding nutritional education and empower individuals to take ownership of what they consume. Thank you for your dedication to improving the health and welfare of Americans and saving lives.
Hello, I'm Congresswoman Alma Adams, Dean of the North Carolina Democratic Delegation in the U.S. House of Representatives, and I proudly represent the 12th Congressional District of our great state. I bring greetings on behalf of the more than 700,000 constituents in my district many of whom face the very issues you have gathered to discuss today at the Empowering Eaters Summit. Thank you, Ms. Nierenberg, for the invitation to speak and to join my colleagues from the North Carolina delegation and Governor Cooper in engaging in this important conversation. Throughout my time in public service, I have stood as a fierce advocate for equitable food policy that focuses on the needs of our nation's most vulnerable, ensuring that all Americans have access to healthy, affordable food. As the discussions here today have revealed, access to nutritious food, every human being's most basic right, has incredibly profound impacts on our community's overall health. But it's tough to make that right a reality when you do not make enough money to afford nutritious food, when food prices are at record highs at the checkout, and when you're forced to make impossible decisions between paying for food and rent or medicine or transportation. And as I have said over and over, you can't be healthy if you are hungry. And that's why hunger and nutrition should not be partisan issues. But unfortunately, some of our most vital nutrition assistance programs are under attack. These programs like SNAP and WIC support millions of people, especially children, nationwide. As a member of the Agriculture Committee working on the Farm Bill, I'm holding the line against attacks on SNAP. We must continue to advocate for the protection of these programs. In that spirit, I commend you all for coming together to support a national strategy on hunger, nutrition, and health. This country needs more people who grasp the connection between hunger, health, and quality of life in America. I hope this summit conversation will help shape food policy here in North Carolina and around the country in the years to come. And I want to personally thank all of you and the organizations you represent for being engaged on these issues. Thanks also to the Sanford World Food Policy Center at Duke and Food Tank for demonstrating how much more we put our minds together toward a common goal. I wish you well in the rest of your proceedings, and God bless you all.
I love those videos. That made me really happy. I get to sit here with one of my heroes. I've known Luis for a little bit now, and I've been a huge admirer of FRAC's work, and I'm so hoping that you can share with this audience what you do and why it's so important.
Well, thank you so much, Danny. You know, at FRAC, we kind of start with the premise that we believe everybody in this country has the right and should have the resources to live to their highest potential. And that really starts with making sure that they have their basic human necessities taken care of, including food. And we believe food really is a basic human right. And if you have that, and if you have the way to provide for yourself, for your family, you can live to your highest potential. And at FRAC, what we do is we want to make sure that that's made possible through the federal nutrition programs. And you heard a lot about that earlier: SNAP, WIC, school meals, and their FDIPR for the Native community, and there are many others. But it takes groups like FRAC and lots of other people here who are here today, and Food Tank as well, to make sure that our policymakers do the right thing, that they protect these food programs, that they strengthen them, and that they make sure that they work for folks.
Absolutely. Thank you for that. When I was listening to Congress member Adams, she talked a little bit about the impossible decisions that families have to make right now. And so I'm wondering if you can talk about sort of the state of hunger in the United States.
Yeah, absolutely. And big shout out to Congresswoman Adams. I mean, she's been really one of the big,
fierce.
Yeah, one of the big hunger heroes in our Congress. And everybody has been talking about the moment that we're in. I think there are different ways to look at that. One is the political moment that our country's in. Also, one that we are kind of coming out of COVID and we're learning a lot of lessons. And unfortunately, on the hunger side, we're seeing some hunger rates start to creep back up.
Right.
This is happening for a couple different reasons. We see, obviously, we talked about food prices earlier, and also there was a reference made to how some of the pandemic era benefits have been rolled back. I think the Congresswoman had mentioned that. So one of the things that we're concerned about is the rise in hunger rates, but also we do have solutions in place. There are policies that are making their way through the Congress that we need to make sure people in power know that we are supporting, and people know that this is an important way for us to address hunger in this country.
Thank you for that, Luis. I'm wondering if you can talk about some of the barriers folks are facing. So you mentioned, the pandemic has definitely been a huge obstacle. People lost their jobs. Some of them couldn't go back to making the same salaries they were before. Some people had to move. There are lots of things that prevent people from getting proper nutrition and having healthy diets. One of them we talked about before is sort of the home infrastructure, right? Not having, the skills, for example, or working kitchens. What are other obstacles, and how can we work to alleviate them?
Yeah, these programs they're great programs, and they can be made even better by addressing some of the barriers that we know. So, and I think we owe a big shout out to the Biden-Harris administration for calling some of that stuff out in the national strategy to end hunger. We talked about school meals a little bit, but one of the things I wanted to make sure that folks knew about was at FRAC, we're really proud to be working with a lot of other folks on a national coalition to make healthy school meals for all available to every school child in this country. Full stop. Full stop. It's we saw the benefit of this during the pandemic when there were USDA waivers that allowed parents and kids to access school meals at no cost. And when those got rolled back, there was confusion and even a return of stigma that we saw. Before the pandemic, we heard just heartbreaking stories, and we're worried that they might be coming back, of children being denied food because they have outstanding school meal debt. Either they get their food taken away, or instead of the food that they get in the line, they get a cheese sandwich or something like that. The cafeteria should not be a place where kids get stigmatized. It just shouldn't. And we have, we don't means test other things in our public education system. We don't means test if a child needs a computer, or we don't means test if a child needs a book, or we don't means test if they need transportation to school. And I think we've all heard and we all know that food is and proper nutrition is fundamental, absolutely necessary for kids to have good education. Other barriers that we want to make sure that we address are how people are accessing the WIC program that we've talked a little bit about today. Fantastic WIC program. Participation starts to fall off dramatically. We know half of the babies born in this country, half, are touched and benefit from the WIC program. And then so what happens afterwards? So for example, right here in North Carolina, we're working with partners in Fayetteville, in the Fort Bragg community, to understand how can we make this program more accessible. And even programs like SNAP, SNAP is our country's first line of defense against hunger. We've heard a lot about it, and we need to make sure that it is protected and strengthened, and particularly in an upcoming Farm Bill conversation. But Danny, let's be clear. I mean, it's a hard program to access, right? They do not make it easy. There is a cumbersome application process. There are waiting periods. There are onerous requirements, but particularly for college students who have to work 80 hours a month. I mean, and still do full-time schoolwork. We need to make sure that these programs are delivered in a way that that people can access them. They can access them with dignity as well. Because as we've heard today, and I think everybody is kind of understanding that inextricable link between hunger and health. And we have these programs that have been proven time and time again to improve health outcomes in this country. And if we're making it harder for folks to access them, it really kind of makes it quite difficult for folks to achieve the health outcomes and improve their livelihoods.
Yeah, absolutely. So, Luis, you've said a bunch of things that blow my mind right now. One is that there is a term that is school lunch debt. That just blows my mind. That should never happen in the richest country in the world. The other is, we've heard this throughout the day, that there are these continuous attacks on SNAP, but we know how effective it is, and we know it's often difficult for people to get. And people like me are always talking about how food is a nonpartisan issue. It's the only, nonpartisan issue we have left. But it's pretty partisan right now because of things like SNAP. How do we get past that?
You're right. We absolutely need to address it. I think one way that we all need to think about this is we need to meet people where they are in terms of where they're coming from on this. I talked about a little bit of the sort of North Star that drives us at FRAC, and that is a country where everybody can live to their highest potential and have the nutrition that they need in order to reach that potential. And that is something that really is just sort of so integral to our identity as Americans. It's integral to who we are as a country. And as someone whose parents were immigrants, that is very, very much part of what I heard growing up around the table, very much kind of within my DNA, and why I'm so passionate about this work. I think the other thing we need to understand is not only are these programs like SNAP important for people to reach their own potential and improve their health, there are also incredible economic drivers. We know that for every $1 spent on SNAP benefits, local economies, and we've talked a lot about local economies, right? So we're talking about farmers, we're talking about retailers, we're talking about other restaurants, other people who are in the system, and other people who are part of the food system. For every $1, local economies grow by $1.50. So that is that's actually one of the best ROIs in the fiscal budget. And so when we talk about economic resiliency, when we talk about improving jobs, we know that, and Norbert talked about this a little bit earlier, about how important it is to address some of the root causes. Programs like SNAP have this sort of virtuous cycle benefit where they put food on the table, they grow local economies, and they produce jobs, which ultimately is what we need for folks to get out of hunger. People need to make sure they have the economic resiliency that they should have to provide for themselves and their family in the way that's most appropriate for them.
And a living wage. But
Yes.
I want to talk about how FRAC has been such a great convener. And, we talk about the obstacles to filling out the SNAP paperwork, but there are lots of organizations, including FRAC, but many others that you work with that help folks do that. But they need funding to do
Yes.
that. And where do you see sort of the future of that? Where do you see, because more and more people, food prices are still very high. More and more people are hungry. We're going back to the rates during the pandemic. Where does the funding for that come from, and how can we increase it?
So it comes from a variety of different sources, and one of the things that was called out also in the Biden-Harris plan to end hunger was the need for everybody to pitch in on this. So right now, some funding for that comes from the government in terms of what people call outreach programs to make sure that people who either want to access the program or don't know about the program learn about it, and they have some assistance, again, because it is quite difficult. But that's not the entirety. The government doesn't fund the entirety of that. in most states, it's up to about half of the money for that. So a lot of that other money comes from philanthropy. At the beginning of the pandemic, I remember making this case a lot because people would see queues of cars stretching like for 7 miles. I mean, I distinctly remember I think it was a New York Times front cover above the fold, the San Antonio Food Bank, and that picture, and everyone's like, "Oh my goodness, how do we get here? Let's make sure we help this sector," and that's great. And the food banks do tremendous work. But we know that for every SNAP meal, every meal that the food bank provides, SNAP provides 9. So we're talking almost about a 10-fold level of increase. And I would make the case that sometimes, someone filling out a SNAP application doesn't make for great TV, right? Yeah. But the big, dramatic, panoramic drone shots of the 7 miles, boy, that grabs people's attention. So it's really, really important that we raise the awareness of the work that a lot of these organizations are doing in local communities, like the local anti-poverty groups or the local Appleseeds. The food banks are doing this work as well. The food banks are now the largest provider of assistance of SNAP applications, but they're not everywhere. So we need to make sure that these other groups receive attention, that they receive funding, because sometimes these less sexy ways of addressing hunger, but that we know are super effective, will get overlooked.
It seems to me that storytelling has to be a huge part of this. And I know that you do that every day. Do you have any anecdotes or stories that you want to share with us that have come from FRAC's work? Yeah, a couple. I mean, I remember very early in the pandemic, we heard how we sponsor a group, the group that does this work in the state of Maryland. They received. Where I live. Yeah. We received, gosh, it was thousands of phone calls at the beginning of the pandemic. Really kind of overwhelmed our team. One of the folks that called was somebody that's like, I don't live near a food bank. I don't. It's very hard for me to access these distribution centers. But there are stores nearby that say they accept EBT. How do I get that? And this is somebody who is a professional, but they hadn't encountered the need for that. So we need to make sure that people understand that these programs are just they're an integral safety net to folks, and that they're actually by design there for this specific purpose. When people do hit hard economic times, that's when the program's supposed to step in. Yeah. That's why it's called the Supplemental Nutrition Assistance Program. Right, that's what the acronym SNAP comes from. And then, we've been talking a lot about the importance of good nutrition as well. And on a tour that I was doing out in California during the pandemic, I was fortunate to be able to visit the farmers market just right in the shadow of San Francisco, of City Hall in San Francisco. And I was talking to a mom she came in tow with her very young children, and was so appreciative, and but also mentioned the importance of having additional funding, like through GusNIP or other programs, to buy fresh fruits and vegetables. And she was telling me, she's like, we don't get to do this every day. And so I guess it was a certain beginning of the month or something that she received this additional benefit. And she was able to bring back fresh peaches, fresh blueberries to her family. And she was talking about how her children really loved it, but it was not something that was available to them with the regular resources that they have. So we've seen, we see and hear these stories. We want to elevate these stories, including the positive ones, and also the other ones to make sure that people understand how
important and integral these programs are to making sure that kids and families have the resources that they need.
Yeah, it's been too easy to overlook the hungry in America. We cannot do that anymore. I'm wondering, and I've asked this question already today, but I feel like it bears worth repeating. You know, and one thing I admire about you is that you work so close with policymakers. They all know you and know the organization. And so what is your advice on continuing to make sure that these issues are nonpartisan, that Republicans and Democrats and everyone in between can really rally around them and understand that they will help their constituents, that people will vote on these issues?
Yeah. So, people on Capitol Hill know FRAC pretty well, and they see us coming, they're like, oh, here come people from FRAC again. They want more money for SNAP or more money for this. So, it is so important, and I'm so glad we're here at Duke University, and we're talking to people from the business school. We're talking to people from the healthcare system. We're talking to people from the Divinity School. We're talking to people from the global food policy. I think that is reflective of really what's needed. It requires an entire community to support this stuff, because we again, if we all believe that food is a right, and we all believe that people should have the nutrition that they need to get to the maximum potential that they have in this country, then that's something that all these communities will want to support. Not just the health community, not just the anti-poverty community, or anti-hunger advocates like myself, but also the education community and also the military community. There are so many people who have a stake in this, and making sure that that we work together, that we coordinate and have opportunities like this where you brought us together to hear from the different communities. So important, because I think I've been not surprised, but I'm always inspired and encouraged when I hear people from all these different backgrounds talking about the importance of access to nutrition and access to food.
Yeah, and you've been such a big part of that silo breaking. You continue to be my hero. Everyone should support FRAC. Please go to their website, make a donation. You can do it right now.
Thank you. FRAC.org.
Please give him a round of applause. Thank you so much. Sorry, now I've lost my place, everyone. Just give me 1 second. Big round of applause for Luis again as we make our transition. So for our next conversation, we're going to look at the idea of food as medicine to treat, manage, and prevent chronic illness. So joining us, we have Chris Collins, the Associate Director of Healthcare at Duke Endowment, Mary Davis, the Healthy Food Director for Blue Cross Blue Shield of North Carolina Foundation, Deborah Clark-Jones, the Associate Vice President of Community Health with Duke University, and Dr. Elizabeth Cuervo-Tilson, the State Health Director and Chief Medical Officer for the North Carolina Department of Health and Human Services. I am not intimidated at all by this panel. Please give them a round of applause. I am intimidated by you all. Thank you so much for being here. Deborah, if I can start with you, when we last spoke, you said that the idea of health equity is talked about a lot. Sorry, I'm trying to get this straight in my mind, but it's important to remember that nutrition is a big piece of the idea. So I'm wondering if you can talk about how food as medicine initiatives can help us promote health equity. I think I got it all.
Absolutely. Can you all hear me? Yep. Okay. Let's just first start with the definition of health equity, because we throw the term around quite a bit, but not everyone fully understands what it means. And when we talk about health equity, we're talking about everyone having a fair and just opportunity to achieve their highest level of health. We also know that there are many barriers to that. Socioeconomic barriers, food happening to be one of those. And so it's really important as we aim to address and advance health equity to make sure that we are being attentive to those social needs or unmet social needs in our community in order to achieve that.
Thank you so much. I want to turn to Chris now and talk about some of the food as medicine work that you're involved in that engages people with lived experience. And we've talked a ton about lived experience, but why is it so important that those voices are heard?
Thank you. I'm with the healthcare sector at the Duke Endowment, and we primarily fund the not-for-profit hospitals, and many of them have begun to, due to new requirements, do screening for social determinants of health for their patients. And so in that space, they're identifying people who are food insecure, and we have a workforce shortage, right? So the nurses already have a lot on their plate. Social workers, we need them in the mental health arena. So there is a real effort underway, and we have funded several health systems that are integrating what they call community health workers onto that clinical team. And that community health worker, when they're picked correctly, is really a leader from the community. It is someone from that community who knows the barriers, whether that's a food desert or the difficulty of filling out a SNAP benefit for someone who maybe English is their second language. And so they work very closely and help that individual navigate. And often these things are interconnected, right? So we uncover that somebody is food insecure, but if they're also homeless, they're not going to be able to prepare the food. They're not going to be able to store the food. And so they can address sort of the host of a really holistic approach to health. And so, and there is no shortage, unfortunately, in this country of people with lived experiences and difficult experience. And we're finding them to be really effective in this work. And we're actually worked with Dr. Tilson and some of the folks on her team, and we're tracking some of the outcomes that are also being tracked by the 1115 waiver. And so we can see reductions in emergency room utilization or readmissions, in which, in turn is beneficial for the health system in that they don't have readmission penalties. And so that also helps a bit with the sustainability in a health system. If they're helping to achieve those goals in value-based payments where they're able to help meet clinical indicators, if they're bringing, improving the hypertension or the diabetes or any of those things, that's an incentive to continue to maintain the staff, even though we may have seeded it with grant funding.
Absolutely. A lot of what we've been talking about today, I feel, is about building relationships. So, Mary, how do you go about developing those relationships with local communities that you work with? What has been most effective?
Yeah, thanks so much. So today, this week, I was lucky enough to be at a convening of 10 of our community-based organizations that are delivering various kinds of food as medicine interventions, kind of from the mountains to the shore of North Carolina, and they're all doing it in their own way. And what I was really reminded is that food is love, food is community, food is connection, and food is culture. So what these community-based organizations are delivering is so much more than food as medicine.
Right.
I mean, it is so much more, kind of to your point, Chris, right? It's, they're addressing social isolation. They are supporting our local farmers, our local food producers, which also supports soil health and climate health. They're building stronger communities, kind of et cetera, et cetera, et cetera. So we are so happy to be working with them to help them build their capacity to deliver food as medicine in North Carolina.
It's so lovely what you just said about, food as medicine is all of these other things. It's love, it's labor, it's community building, but it's very difficult work to do, and those relationships take a long time. And I'm wondering if maybe you all can answer this. It takes a long time to build those relationships, to build the trust, to have outsiders come in and start telling folks what to do, or that's a very difficult endeavor, and I'm wondering if maybe we can all talk about that.
I mean, just to add, the wonderful thing about the community-based organizations being involved in food as medicine is that they have the relationships. They've been there. They're not popping in because this is the new hottest topic, right? They are there.
Yeah.
The difficult relationship is is how they can partner with healthcare in an equitable way to deliver this.
Elizabeth, do you want to go, Deborah?
Sure. Just two things. Based on what Mary was just saying about social isolation, I was just looking at some data recently about Meals on Wheels, and over 90% of those seniors felt safer knowing that a volunteer was coming by the house to deliver food. And I think that that's something that we have to be mindful of. At Duke, I just want to highlight a program. It's actually an analytics program that we started a couple of years ago. It's called the Collaborative for Advancing Clinical Health Equity, CACHE for short. And we're looking at inequities in our clinical outcomes, but one of the most important aspects of the program is that we work closely with community-based organizations in better understanding those inequities. But even more important, they are helping to co-design the interventions. Once again, getting back to those lived experiences, making sure that we have the right voices around the table. And those programs by far would not be as successful as they've been without those voices at the table.
Those right voices around the table, I wonder if any of you have encountered sort of opposition, like, hey, we don't want to work with you. We've been doing this on our own. Deborah, you can go. You had your
I feel like I'm hogging the mic here, but
I'll get to Elizabeth in a second.
You know, most of folks that are in the healthcare profession are excellent at what they do. Preeminence is the term that we certainly use at Duke Health when it comes to the type of healthcare that we deliver. But we don't often or always recognize the assets in our community. And so I'm really happy to be a part of an academic medical center because this is something that our researchers are very keen on, community engaged research. Many of those researchers are also providers. I will also say that I was just talking to a provider at one of our hospitals the other day, and he is working around some housing initiatives. He just took it upon himself, just with a passion to help patients. And he stated to me, I am a better provider based on this engagement in community. And so that's something that we really want to socialize more, just to understand the benefits to the health system through that engagement.
That's really great to hear. Elizabeth, I'm so excited to turn to you because we all know that the private sector is invaluable to all of this work. And I'm wondering if you can talk about sort of how the public sector's approach to food as medicine is evolving at the state level, and what is most exciting to you right now. What are you most optimistic about?
Yeah, I'm happy to. I'll answer that, but I also want to get back to some of the questions
Please.
The partnering. I think one of the risks, I think a huge benefit is linking healthcare and social services, because that's where the money is when we think about food as medicine, how we're going to pay for it, and leveraging healthcare dollars, huge opportunity. The risk is healthcare comes in and says, oh, we know how to do it. We can figure out housing, we can figure out food, and that healthcare system feels like they then will be the delivery system for social services, where we have the expertise, the trust, the intentional routing in community. So that's one of the risks we have to think about, is not having the healthcare system come and take over, but how do we connect and lift up and really leverage the expertise that is there in the community pieces. And I think in general, we're getting there, but sometimes there's those sources of tension there. But getting to the role of state government, and I think there's incredible opportunities of collaboration between federal, state, and local governments. And when I think about in North Carolina, what we're doing is, one, thinking about how do we maximize enrollment in our federal benefits. So we've talked a lot about WIC, a lot about SNAP. How do we think about maximizing enrollment? We've been doing some work internally with our own data systems. You're enrolled in Medicaid, you're enrolled in SNAP, you're not enrolled in WIC, but you're likely eligible. So how do we think about our own data so that we can then give it to our local Department of Social Services and Health Department so that they can do that outreach and get people maximally enrolled. The other federal program that we haven't talked about is Medicaid.
Sure.
Right? And thinking about Medicaid expansion, which I am so thrilled to say happened in North Carolina. And we, day one, we enrolled 274,000 people. We've been enrolling more than 1,000 a day. We're up to almost 384,000 people that we've enrolled since December 1st.
Amazing, congratulations.
Yeah, and we don't think about Medicaid solely as a food program, but when we can cover people's medical costs, then their dollars can go to food and housing.
Absolutely.
And we can help people get access to care so they get more healthy so that they can get a job and be stably employed. So Medicaid expansion, I think, is incredibly important, and I really hope that North Carolina, by expanding, will be that opening door for the rest of the Southeast, because when we think about equity and disparities and what populations are disproportionately impacted by food insecurity, it is our populations in the Southeast.
Yeah.
So I'm really hoping that's just an incredibly important lever. Second, I think state government can help to build some of that infrastructure and ecosystem that we've talked about so that it really helps our health systems and our other payers be able to innovate. Chris talked a little bit about screening. So one of the things we did was had a standardized screening set of screening questions. We have a statewide referral platform. So when a provider screens for and finds food insecurity, we can refer to the food pantries and have a closed loop function. And so thinking about those ecosystems that can be used across all of our populations. And then third, an incredibly important place that states can lean in, and not that all food insecure people are covered by Medicaid, because there's a lot of food insecurity everywhere, but Medicaid is an incredibly important lever, and so if we can lean in and leverage our Medicaid dollars to not just buy health care, but buy health, that's an amazing thing, and we've done a lot of that in North Carolina. Just with our Medicaid managed care plans, there's lots of financial levers and incentives that we can do to make it easier for health plans to pay for food and housing, and as you've heard a couple times, we have our 1115, which that's a wonky term, but that means that we got permission from the federal government to be flexible in how we can use Medicaid dollars. And so what we're doing now in 3 areas of the state, we are paying for 29 services, food, housing, transportation, and interpersonal violence, are starting to show amazing results. We're getting our next interim evaluation will be coming the end of this month, looking at can we actually effectively deliver services? Does it decrease social risk? Does it decrease ED utilization, hospital utilization? Does it improve health? And does it save money? And so we're really excited to see that. And then what we're excited too is that we also proposed our next 1115, so submitted that to the federal government in October. And our goal is to hopefully be able to do that statewide, which will be great. Yes, yes. And tweak some services, things that we have learned. And the other piece, just getting back to some of the climate change from the earlier panels, because North Carolina, we're hit by hurricanes over and over, and it's the exact same it's the exact same population. And so one of our proposed eligibility categories is that if you've been the victim of a natural disaster, for 12 months after that, you'd be eligible for the pilots as well, because we know families need to rebuild. So we're really excited about that, and that, again, is that collaboration between federal, state government, and then we are completely reliant on our local partnerships to actually deliver that program.
Like Durham.
Yes, so Durham is not one of our pilot regions yet,
okay.
but I'm sure they will be. But our pilot regions, no, it's all good. Our pilot regions are mostly rural, actually our rural area. So North Carolina has the 2nd largest rural population in the country.
Yeah.
So our pilots are in the western part of the state, and then in the kind of southeastern part of the state, and then the kind of eastern, northeastern part of the state for now.
Thank you so much, Elizabeth.
That was a lot.
Go ahead.
Yeah, if I could just mention this also, the 1115 waiver program has really also incentivized members of our team, some of whom are in the audience right now. Even though we're not a pilot, they have been working with community-based organizations for years now, helping to prepare the infrastructure for reimbursement, knowing that none of us can do this work alone. And so even though the funding didn't flow to it, still great work, great benefits, just knowing that that is happening right now, and really proud of our folks too.
Thank you. This is a question for you all, but I want to start with Mary. I'm wondering if you can talk about some of the broader benefits beyond individual health of food as medicine programs on local food systems, because this, you said before that this goes beyond the individual, but sort of specifics. What are you seeing?
Sure, then thank you for that question. So I'll just speak to the 10 community-based organizations that we fund in North Carolina. And among those organizations are 2 food hubs, right, who purchase their food locally, support farmers locally, and then aggregate and distribute that food, right? So already, Food as Medicine is supporting local farmers. And then we have a farm. We have an actual farm that's also participating with their local health system there and growing the food for the patients of the health system and then providing that food. So, I mean, there's direct benefit in terms of more dollars flowing to our local farmers and local producers and those people that serve those markets and serve those farmers.
And that will make folks want to be farmers.
Well, it might make folks want to be farmers, but it's bringing more money into the system,
right.
and that's a good thing, right?
Absolutely.
So for us, that's a big, and those are rural, lots of eastern North Carolina places that I'm talking about. So we need those dollars in those communities, and that's why we really talk about food as medicine. As this is good for community health, and this is good for community wealth, and it's that multi solution that Rachel was talking about earlier.
Mm-hmm.
That's how we see it.
Chris, can you talk about some of these broader benefits?
Yeah, so we also have an initiative that's really trying to go upstream called Healthy People, Healthy Carolinas, and it's really trying to prevent chronic disease and obesity. And so what those drivers, access to healthy food is a really important component of it. And the way it's organized, it's a collective impact model, which is, we're trying to bring schools and employers and the farmers and the churches and everyone to the table, city, county government, and we let the community decide where they want to start. It's not anyone coming in saying you need to start with this particular program, but it might be starting a farmer's market. It might be a garden at the school where children learn to grow and see how vegetables actually are grown and eat them right, to build the love right there. And so it's really that collective impact, because I don't think any of us are going to solve this on our own. Government doesn't have enough money. Philanthropy doesn't have enough money. It's going to take us all really working hard together, and everyone has a role to play in making their space healthy, right? We want to make the healthy choice the easy choice, and that's employers, that's everybody all together. And I will say, when you start to do this work in communities become empowered, programs become less siloed, and many of our Healthy People, Healthy Carolinas have gone on and gotten USDA grants that then help the local farmers. I do want to add one thing to the question you had with communities, and if communities ever sort of push back. If you have them at the table right from the start and they help decide what they need and what they want, that's really important. And I would add one other thing that we're really sensitive to is everyone else at that table is paid, and the community member is not necessarily paid. So being respectful and valuing their time, either you let the community health worker, 20% of their job is sitting at the table representing the barriers they see when they try to help patients get with those community barriers. But I think that's another thing, is not to take, there's pushback when you take the community for granted, and there's pushback when you ask them what they need, you don't deliver, or you ask them again what they need, and again what they need, and you've not done anything about it. So I just wanted to go back to that question about where sometimes there's a little bit pushback, but if you design it right from the start, and you empower people right from the start, then usually there's not.
Again, so common sense. Elizabeth, what are those broader benefits?
Yeah, and I think part of the design of our pilots was specifically creating a network of existing, what we call human service organizations on the ground. So not necessarily contracting with big national partners, but who is already doing the work on the ground. We actually were able to have capacity building dollars to firm those organizations up and then start having the flow of dollars to those organizations. And so it's the opposite of a vicious circle. I don't know what that is, a beneficial circle?
A
Right?
virtuous
So
cycle.
a virtuous cycle, there we go, right? That we can start, because our social service sector has been woefully underfunded forever, right? So we start getting money flowing to those organizations. Then they can then increase their capacity, their technical skills, and then they can hire people, right? And then we start flowing the money in, and so not only are we helping the individual who's receiving that food box,
Right.
but we're also helping that individual who now can be employed because that human service organization now has a stable funding, and that you're creating that community wealth, which also is an investment in health as well. So it's just a win-win-win when you can leverage dollars to pay for food. It's just it's a win-win, and so
many
we're very
wins, yeah.
committed to making sure that we're funding our local community-based organizations through this.
Absolutely. Deborah, do you want to comment on broader impacts?
Well, I'd like to actually comment on something slightly different.
Of course.
I just have to say, and I'm going to borrow Mayor Williams' term, but our students are dope. They have truly been on the forefront of a lot of great food security, nutrition security initiatives, working with our providers, receiving actually referrals for patients that are food insecure. There's an organization called Root Causes. They have a fresh produce program, doing phenomenal work, delivering food on a bi-weekly basis. We also have the Food Recovery Network. They are collecting the surplus food with our dining services. It's also a climate initiative, but they are delivering that food to community-based organizations. But just to see that integration of what our students are doing, a lot of volunteer work that they're doing to advance this particular topic, and I just did not want the chance to, or missed the chance to actually celebrate what they're doing.
Thank you so much. So important. Just very quickly, and we only have 1:45 left. I know. But so whoever wants to answer this, I think, how do we keep sustaining this food as medicine work in a way that involves all of the players that we've been talking about? How do we do that? Is it funding? Is it, having folks like you on stages like this? Is it, more academic programs? What is actually going to move this forward? You look like you want to answer.
I mean, policy change, right? So let's be honest there, right? So we need policy change. We have great stuff going on in North Carolina. We also need great stuff, going on at the federal level. Right now, these initiatives are kind of being sustained through champions at health systems, right? And champions in the community. And that's not going to cut it for a long, and grant funding, right?
Right.
That's only going to go so far, right? So we need systematic change to support these efforts. And the other thing I'll say is that, the CBO, the community-based solution is a beautiful solution, as we've all acknowledged here. And we need to make sure that they're not boxed out as the generally for-profit companies can see the dollar signs are flashing, right? And as they start to get into this space and are able to offer, solutions at scale, right? So we need to all be mindful of that as the field evolves.
Such a great reminder. Thank you all so much. Please give this panel a round of applause. Thank you all so much. I say this every time it happens, but I'm always so happy when there's an all-woman panel, because a lot of my career, I'd be the only woman on a panel, and it made me mad. So I'm glad for that. I'm now excited to invite our next speaker, Valdemar Velasquez, the International President for the Farm Labor Organizing Committee, which is a FLOC, which is part of the AFL-CIO, to join me on stage. Please give him a round of applause. While he settles in, we're going to play 2 more videos. The first comes from U.S. Congressmember Kathy Manning, who represents North Carolina's 6th Congressional District, and the second will be shared by Congressmember Deborah Ross, who represents the state's 2nd District. Enjoy the videos.
Hello, I'm Congresswoman Kathy Manning. I represent North Carolina's 6th Congressional District. I'm thrilled to join you virtually for this important discussion. We know that access to nutritious food is key to living a healthy life. Nutritious foods can prevent and even help treat certain health conditions. But sadly, America's nutrition landscape isn't meeting our country's needs. Every year, hundreds of thousands of Americans lose their lives to medical conditions like heart disease that can be directly linked to poor nutrition. And in the district that I represent, many communities are considered food deserts, areas where residents simply lack access to grocery stores. For communities like these across North Carolina, improved access to and affordability of healthy foods would change countless lives and even save lives. That's why I'm proud of the Biden-Harris administration's efforts to address the health needs of Americans with a food is medicine approach and their commitment to bringing down the cost of nutritious foods. I'm grateful to Food Tank and Duke University's World Food Policy Center for hosting this important event. Thank you all for the work you're doing to address America's nutritional needs.
Hello, I'm Congresswoman Deborah Ross from the 2nd Congressional District in North Carolina. And I'm sorry I couldn't be at your summit today, but I couldn't think of a more important issue, particularly right now, than dealing with food insecurity, hunger, and how we provide for people not only here in the United States, but around the world. Last session of Congress, I worked on a committee that looked at hunger and nutrition issues and ended up providing a lot of information for the White House's conference on hunger. And we are hoping that this administration can help even more people. But in Congress, we are struggling every day. Just this week, we had to extend another deadline so that WIC recipients could continue to receive the essential food, nutrition, and services that they need, both the mothers and the children. Having that firm foundation in life will make all the difference for these children's future. But WIC is on the line, not just because of the budget, but because of the Farm Bill. I visited a WIC center in my district and heard firsthand how important nutrition and food programs are here in the United States. And then I had folks visiting me in my office talking about the importance of USAID and World Nutrition Programs. Folks, food is basic. We need it in order to live and in order for our bodies to survive and thrive. And it is up to us, the richest nation in the world, to make this a priority. I thank you for investing your time today in this crucial issue, and please know I'm with you in this fight.
Round of applause for the Congress members and a round of applause for Baltimore, please. It's so great to have this man here. I've talked to him many times, and I know I keep calling everyone my hero, but that's why we put these summits together, so that I can see all of my favorite people, and Baltimore is one of them. So I'm so glad to see you, friend. I'm wondering if you can talk about the Farm Labor Organizing Committee. It's one of the oldest organizations representing and advocating for farm workers here in the United States. What is it, and what are your biggest challenges?
Our biggest challenge has always been from the inception of FLOC, how do we create a sustainable production in labor-intensive crops? That's it was a difficult riddle at first.
Sure.
But we pioneered a breakthrough agreement in 1986 with the Campbell Soup Company after a 8-year strike of over 2,000 of us that walked out of the tomato fields. And a 7-year boycott. When we finally came to terms with the company, we negotiated a price increase for the farmers that were our employers to be able to double our wages. At that time, we were getting paid 16 cents a bucket for a 33-pound basket of tomatoes, and the growers were getting paid $34 a ton. So that 16 cents multiplied by 60, 2,000 pounds in a ton, that's $9 and a little under $10 of that $34 per ton that the farmers got paid. I said, if we want to even and the average contract with a Campbell's tomato grower at that time was 40 acres. When you multiply his profit margin per acre, in order for him to break even, when you took consideration of fertilizers and diesel and all the other things to get that tomato plant into the ground, transplants, planting, cultivating, hoeing, his break-even point, he had to yield 16 tons an acre. The average yield in 3 years before 1986 was 18 tons. So he was making $68 profit per those 40 acres. So when you deduct that $9.60 of our 16 cents, it left him with just that balance. He was making a profit margin of $68 per acre. Multiply that by 40, that was his profit margin, some $3,000 and some change. And I said, if we ask for a 2-cent increase in picking tomatoes, you're going to dig into that profit margin, he's going to go out of business. So we had to have the company increase the price of tomatoes to facilitate wage increases for the workers. We duplicated that model with Vlasic Pickle, Heinz USA, Dean Foods, and Jane, Green Bay, and in the early 2000s, the Mount Olive Pickle Company here in North Carolina that broke open the labor agreement that we have here in the state, covering now around 9,000 H-2A GIS workers from the mountains to the coast. And so that supply chain agreement is our biggest challenge, and there's not a conflict, but what I liked about some of the other presentations we had here today was getting people to think out of our silos.
Yeah.
I like that.
Yeah.
Because if we don't think what our place is in the global view of where we are in the food production system, we're going to die.
Yeah.
And we're just going to continue to demonize one another and not reconcile and have a sustainable food production system.
Absolutely. And on that point, one of the things that I've always appreciated about you and Flock in general is that you're making a point to distinguish between large farms, corporate farms, and small farms, but you don't pit them against each other. And I'm wondering how that philosophy came about and why you do that.
Well, I think that when we talk about the food production system, we have to think about what our role is in the global issue around the commodities that we produce. And it really boils down to a farmer who invests his land in planting, cultivating, and harvesting a crop that is supplied to major manufacturers and retailers, as opposed to the corporate farms who pretty much control their own markets and market directly to food chain stores and other things. Small family farmers that are suppliers to these manufacturers and retailers are at a disadvantage because they have no way to negotiate the commodity prices. They just have to take what's imposed on them.
Yeah.
And they have to take from that to cover our expenses. And if we really want to see what improvements in agricultural workers, farm workers' lives, we have to think about our role in that entire supply chain and what we have to do to affect that change in order to make it sustainable for everybody.
Right, big and small and everyone in between. One of the things that I think people have a misconception about farm workers is that, these are people who don't have skills. But whenever I've been to a farm and watched farm workers work, it's very arduous labor. They have to be very knowledgeable about what they're doing, especially things like cucumbers. Can you talk about sort of the skills that farm workers have and why it's so important to U.S. agriculture?
When we signed our first agreements with these big cucumber manufacturers that processed into pickles. The Vlasic Pickle Company, Heinz USA, the Mount Olive Pickle Company. We had to figure out what was the need of everybody in the system. The manufacturers in Ohio and Michigan wanted the number ones, the gherkin that fits whole into a jar. Mount Olive Pickle Company wanted 2As and 2Bs. That's the larger ones that you make into slices, for sandwiches and so on. That's their need. How do we as workers then harvest more of those sizes than any other size? Because a cucumber can grow one size overnight on a hot, humid night. Right. So we had to, in Ohio, we had to train our workers to how many rows they could pick each day, divided into 5 days, and allow 2 days to allow the cucumbers to grow. So we go the first day, clean the entire vine so the flower would come up. 5, 6 humid nights, that flower is number one. So when we come back to harvest those first rows, the majority of the cucumbers are going to be number ones. So we had to pick in rotation like that. Yeah. We increased the size of number ones the second year from 18% per hundredweight of number ones to 34% the second year. The manufacturers got more of what they wanted, and at that time, the workers were categorized as independent contractors. We had a plan to convert them to employees so they get their Social Security, workers' comp, right, and unemployment comp covered. But it took the increase in what the manufacturer wanted more so they could afford to pay more for our work.
Sure.
And so we increased that for the farmers and the workers, and we're able to transition everybody to employee status with the extra income that the companies paid for more of what they wanted.
Right, more knowledge, more expertise.
And that took some skill, let me tell you.
I can't even imagine. A lot of math went on that I could not comprehend.
I mean, when you really get down to it, it's all in the numbers. You got a farmer. I mean, my personal feeling is that we have to have a policy in America where if you're going to impose, like in the H-2A program, they got the so-called prevailing wage, which is known as the adverse effect wage rate. It increases every year. It's $15.81 for North Carolina this year. It's almost $1 increase from last year. And some of those farms that are marginal, it's tough for them to absorb that.
Yeah.
So we have to figure out a way to tie the commodity prices those farmers paid to those policy things coming out of Washington.
Right.
If Congress can set prevailing wages for workers and set minimum wages for American workers, why can't they set minimum commodity prices for farmers?
Thank you, thank you. I mean, I think that's another thing that you've been so good at doing is you've encouraged farm workers, small farm workers, to organize together with small farms so that you can achieve that kind of goal. That has not always been easy, though.
No, it hasn't, because over the years there's been a narrative of farm workers against farmers and farmers against farm workers.
Right.
And it's a false division because it's like it's kind of like Abraham Lincoln, who once quoted from Matthew 12 that a house divided cannot stand. Mm-hmm. We have to unite the house. We have to unite everybody in that supply chain. And small family farmers with labor-intensive crops and farm workers belong in the same. We are subjected to those commodity prices that are imposed upon us. So we had an event October 1st of this last year, and we brought together the North Carolina Growers Association, the Dunlop Commission, Farm Aid, Latino Farmers and Ranchers International, and call for an alliance of small family farmers and farm workers so we can address some of these supply chain issues and talk about pushing for sustainable policies for all the parties involved in agricultural production.
It's real silo breaking that's happening.
It's a challenge because we still have a lot of, we're still buried in old thinking.
Yeah.
Back in the 60s, during the Civil Rights Movement, Lyndon Johnson and Martin Luther King Jr. had this debate about how to empower the poor. And Dr. King wanted voting rights. Lyndon Johnson wanted the anti-poverty program, the Office of Economic Opportunity. Farm workers were showered with all these, monies, for food stamps and all of that. There's some good things that came out of that war on poverty. The Head Start program, for instance, the food stamp program, and those kinds of things. But when you talk about farm workers, we're not talking about disabled or poor, unfortunate people that are underemployed. We're talking about hard-working people that work in very arduous conditions, climate and everything. When they work that hard, it sort of begs the question, why can't they feed, educate, and clothe their families and be rewarded for the work that they do and use that as a proper income? That we deserve a fair day's pay for a fair day of work, not charity. But we've been mired in that thinking since then, and we have to break out of it. We supported that because we felt workers needed a way to transition out of poverty. But you can't do that until you correct the math in the food supply system so that the people on the bottom of the supply chain can create a sustainable life.
Thank you, Baltimore. Yes, please. I wonder, Baltimore, what is sort of on your wish list of policy changes that need to happen, both at the federal level and at different state levels?
One of the things that's kept farmers and farm workers down is lack of ability to negotiate their work, for their work. This is kind of crazy idea, but farmers need to have unions too, small family farmers, to negotiate with manufacturers and retailers. Farm workers need right to form unions. Since 1935, the agricultural workers have been excluded from the National Labor Relations Act. You remember before 1935, we had child labor, exploited labor in the mines, in the textile mills all over the country. When they got the right to organize unions, they negotiated those things out of existence. And so why can't we say the same thing for agricultural workers? We've been excluded from the National Labor Relations Act since 1935 in every reform since then, and including today. The agreements that we won, we've done it by creating alternative independent mechanisms. And we pioneered what we call the Dunlop Commission. And it's the first agreement that I negotiated with Campbell Soup back in '85 that really the framework was rules and regulations for representation procedures, authority to issue fine penalties and make whole remedies if you violated the rules for collective bargaining. And it was an independent commission signed by the Campbell Soup Company. So every company that we challenged from that point on, we got them to recognize that commission first before we negotiated a labor union. But it allowed the farmers to participate in those negotiations. And the one we won here in North Carolina was with the Mount Olive Pickle Company. And they're the ones that brokered the agreement with the North Carolina Growers Association by increasing the price of cucumbers to modify the prices that we had to get them covered under a collective bargaining agreement. But that we have a voice then, and the farmers have a voice. And I think that that's the most important thing. But when we're voiceless, we're at the mercy of those who want to give us charity.
Thank you, Baltimore. That voice is so important. And I think part of what makes your work so powerful, just knowing you personally, is that faith is very important to you. And, the faith-based community and the farm worker movement have been very closely intertwined. And I'm wondering if you can talk a little bit about that.
Well, if we don't reconcile the old narratives historically that pits us against each other, we're going to end up stagnant and staying where we are and at the mercy of everything around us. But together, I think we can challenge some very important things that need to be addressed. One is the fact to recognize that we're part of a global economy and we have global competition. Let me give you an example in tobacco. Everybody knows tobacco in North Carolina. Tobacco is being challenged greatly because there's only like 6 or 7 buyers of all the tobacco in the world. And one of them is Alliance One over here in Greensboro. They buy all the tobacco for Philip Morris International. And they buy tobacco all over the world. They compete with North Carolina. We visited our counterpart tobacco workers in Malawi, where Alliance One has a big investment. We asked the guys at the flue-cured tobacco operation how much they got paid. When you translated their currency into dollars, you guys are getting paid 85 cents a day. Now, how are you going to compete with that? We're not going to compete with that. The farmers are not going to compete with that. So we have to have a global approach to this with our foreign policy and with our trade agreements that we have. Our trade agreement with Canada and Mexico, we now import more food from Mexico than we export. That's turned around in the last decade. And because the trade agreement that we have with Mexico allows corporate farms to set up operations in Mexico with no tariffs or anything on those products coming in. It's like growing it in the United States, much cheaper in Mexico. How are farmers in North Carolina going to compete with that sell their strawberries to Walmart, for instance, or sell their tobacco to Reynolds America? We're not going to compete. We have to have a global approach to that. I don't think the farmers can do it by ourselves. I don't think the farmers can do it by themselves. But if we did it together and join hands and find allied partners in the sympathetic, progressive communities around the country, we can make it happen. Nobody thought in the 80s that a ragtag group of tomato pickers could compel the Campbell Soup Company to sit down and negotiate with us as equals. That happened because there was enough people who cared in America. And I think I have a faith in you and all of those of you who care about the food systems in our world and in our country, that the support will be there to make these impossible things possible.
Woo! One final question, Baltimore. What is your biggest goal for Flock this year, remembering it's an election year?
Our biggest goal right now is to submit a complaint under the USMCA challenging the U.S. Under the trade agreement. Article 23 requires each country to have robust mechanisms on freedom of association. If I know this pertains right now to the H-2A workers, the guest workers that come in from Mexico, but it have ramifications for the rest of the agriculture production in the United States. Because if agriculture workers that are H-2A have collective bargaining rights, that opens the question for the rest of the 1.5 million farm workers in the United States and their farmers who employ them. And I think that if we can get that complaint filed this year, that's one of our goals. The other goal is to do something about these independent farm labor contractors. They're the worst abusers of this program. It's not the farmers, it's these independent contractors. Every horror story that you hear, including the Operation Blooming Onion that the Department of Labor filed, in Georgia, those are all independent farm labor contractors. Those weren't family farmers, but the farmers got blamed for that because that's the prevailing discussion. And you have to really understand those dynamics. And we need to have our Congress change the definition of what is an employer that allows them to recruit H-2A workers in Mexico. And we can get the Mexican side, Congress, to issue registration of these contractors and maybe make them issue a high bond if they violate these things. And I think that those are some of the immediate goals that we got planned right now because we got to stop the abuse on both sides of the border of this program.
Absolutely. Thank you, Baltimore. Always a pleasure to have you. What a true honor.
My honor. Thank
you so much.
Danielle.
Bigger round of applause. He's a hero. In our next session, we are going to hear about the link between food security and environmental sustainability. Joining us, we will have Debbie Hamrick, the Director of Specialty Crops for the North Carolina Farm Bureau Federation, Lauren Davis, a professor in the College of Engineering at the North Carolina Agricultural and Technical State University, Jennifer Norca, the Director of Regulatory and Scientific Affairs at the American Frozen Food Institute, and Stephen Jennings, the Stakeholder Relations and Brand Lead for Health and Sustainability at Ahold Delhaize USA. And I'd like to welcome back to the stage Norbert Wilson, the Director of Duke's World Food Policy Center, who will be moderating the next session. Norbert, over to you.
All right, thank you. And let's thank Danny for leading so many of these sessions. She gets a small break. I'm really honored to lead this discussion on food security and environmental sustainability. I am actually standing in for Matt Lardy. He was supposed to lead this discussion, but unfortunately he fell ill, and so I hope, Matt, that you're doing much better. We cannot talk about the food system without thinking about its connection to sustainability in its broadest sense, environmental, also in areas of providing social goods, and sustainable farms and sustainable food systems also need the ability to be profitable. And so we have an excellent panel to help us think about these multiple factors as we look at the food system in really constructive ways. So I really want to start off with you, Debbie. Would you help us understand what growers need to produce the food necessary to support food security? And how do you see sustainability fitting into this work?
Sure. I'd like to start by challenging Mr. Baltimore Velasquez on one point that he made. My sister, my brother, and I did shares with my dad, halves for cucumbers a couple of years when I was in high school. And when I was in the 9th grade, we figured out, as Mr. Velasquez talked about, how to maximize our profit by which harvesting number ones. But he said that he was able to let the cucumbers grow overnight. I will tell you that in North Carolina, when the temperature is right and it's raining all day, you can hear the vines growing and the cucumbers expanding on the vine, and you never get caught up. And it is like this panic. I still dream about that sometimes. You know that perennial test we forgot when we were in college, growing cucumbers on the vine and trying to maximize our profit from the 9th grade. So the first rule of sustainability for a farm, and you just heard this from Mr. Velasquez, is profitability. If we can't make profit on farms, the farms simply can't be, they're not viable. Right. And only 5% of farmers in the United States are able to earn a full-time living farming, just 5%. Most of our farms are part-time, and the farmers that are farming full-time are doing an awesome job.
Great. I would like to now turn it over to Lauren and just understand a little bit more about some of the work that you're doing. So we know that farmers and retailers are major contributors to produce the food necessary, are major contributors to food banks. And can you talk to us a little bit about the role that food banks can play, not only in serving communities that they're facing, that are facing food insecurity, but also in reducing food loss and waste?
Sure. So if you think about, on one side, we have roughly, a third of the food that's generated is unsold, and potentially part of that goes to waste, goes into the landfill. And then on the other side of that, we have roughly, as of 2022, 44 million households, Americans, that are food insecure. So food banks are an integral part of the supply chain that helps to connect this potential food that's available to those who actually need it. They work very hard to cultivate these relationships, not only with big box retailers like Walmart, Sam's Club, local growers that we've heard about, like BIPOC farmers as well, to actually try to make sure that this food can be rescued and distributed through their very large network that they have of food pantries, soup kitchens, these what they call partner agencies that are working on the front lines to actually serve people who are food insecure. So in addition to working collaboratively with the food system to rescue the food, they also rely on donations from the community. They work hand in hand with the state and the federal government. They are large TFAP distributors. So they are really doing the work of trying to make sure that the food that would end up in the landfill can actually be diverted to those in need.
Yeah. No, this is really important. I actually want to continue this idea of providing this kind of really nutrient-dense food, especially for families that are struggling. So Jennifer and Stephen, frozen foods are one of the ways of actually changing that food that might go to waste and kind of converting it so that it can be stored a little bit longer. Frozen foods represent really a healthy way to provide nutritious foods to those who are in need. And it can also provide for more affordable and accessible foods. Where do you see opportunities to improve that pipeline of fresh produce that might get transformed so that different individuals can access them?
Yeah, I like that you pointed that out. Let's remember that frozen starts off as fresh, and it's often a diversion market for fresh produce that maybe won't be sold at retail or is in excess. But I think that there's a huge opportunity to work on consumer perception around frozen foods. We are often finding that consumers do not understand the freezing process, and this is one of our most natural and ancient preservation methods, and it's literally just a temperature state. So let's start there. Let's also talk about the technological advancements in the freezing process in the past decades. We create really high quality taste, texture, flavor in frozen foods today. It's not like what maybe your grandparents talked about, like mushy, wet, tasteless food. We do not have the same frozen food as those days and ages. And there's so much innovation happening in that aisle that can meet any consumer's diet, any consumer's preference. You know, there's meals that are ready to heat for people that don't have time or don't have the cooking skills, or there's innovative sides and additions as ingredients to kind of create meals at home. I think these consumer education campaigns should also address how they are nutritionally equivalent to fresh foods. The freezing process actually locks in nutrients over time, and we have that longer shelf life period, so people can access nutritious foods for a longer period of time. Lastly, like you said, it helps with food waste, and this can help at the consumer level with household food waste. And we know through national consumer surveys that messaging doesn't necessarily identify with consumers, but when you talk about food waste as a way to limit economic waste in a time when consumers are really struggling to stretch their food dollars with inflation and all of those things happening in the world, we need to lean in on how frozen can help them limit their food waste and limit their economic waste at home through portion control and portion balance, where you're not making too much and you're not going to throw excess away, or through having that amount that you only need to add into a recipe and you can save the rest for a later period.
Yeah, well, let's start with, does anyone know what the heck an Ajo Deleuze USA is?
I do.
Some hands. Does anyone here know Food Lion? You all better raise your hand because there's one like right down the street, right? So they also provided the food that you guys had for lunch there, which was very appreciative. So Ajo Deleuze is a group of grocery retail brands. We are the largest East Coast grocery retail group on the East Coast, stretching from Maine down to Georgia and over to Tennessee. We have over 2,000 stores. We serve 30 million customers a week. A week. So we have the opportunity to have a lot of impact in this space. We're one of those companies Gavin was talking about on the previous panel. Yes. So we're on the business side, right? And we want to sell food, but we recognize we need to be the role model to nudge our customers towards healthier choices. And one of those paths, part of this question, is to frozen. And what I wrote down as part of my kind of notes to bring up is the pandemic shifted a lot of customer behaviors when it came to shopping. Some of it was you might not have had your favorite vegetable or something available in the produce department because we just didn't have it. So a lot of customers were shifting to frozen options, even canned options. As you know, with the pandemic, everything was kind of selling. But we focus on frozen a lot with all of our brands because of all the reasons that Jennifer just mentioned, even including myself. It's affordable, it's accessible, and the great thing is it lasts a really long time. So one of the struggles with the perception of value when it comes to fresh, sometimes with food insecure customers or even customers with limited means, is that I don't have maybe the refrigerator space for the fresh food, or it won't last as long in my house because we don't eat it fast enough. So frozen does become a really great option. I know my freezer is absolutely full of petite broccoli florets, which Jennifer and I talked about earlier. I love them. So it's part of our job in this space is to bring those options for customers to make the best choice for their lifestyle and family.
Okay. I got to say, in my household, when there's a meal left over, it goes into the freezer. Then it's the debate of, like, did we get it out? So we're working on that. We're working on that. But this raises an important idea about the challenge of supply chains and cold storage. I mean, and it happens at the farm because you got to make sure you can get the product off the field so it's cooled and able to get it so that it doesn't go bad. We know that this is a real challenge when we think about the charitable food sector. I would love to hear you all talk about how important is the cold chain? I mean, and that's probably a phrase that everyone doesn't use all the time, but I think this is a crowd that would actually appreciate hearing the importance of these different actors along the supply chain needing to cool products down and get it to the next person.
I'm happy to start talking about cold chain. So yeah, I mean, if you are unfamiliar with the term cold chain or cold chain infrastructure, it's refrigeration and freezer infrastructure. And it's not just like the freezer or refrigerator at your house. It's at the retail level. It's the transportation trucks that get it from the field to the processor area, from the processor to the warehouse that also has refrigerators and freezers that can hold the food and then distribute it out to the retailers. There is much needed investment to happen in this country on cold chain infrastructure for both frozen and refrigerated foods. I think when we look to like food distribution and food donation, that is a huge area where we could bolster cold chain infrastructure and capacity, because oftentimes, I think the food banks have the freezer and refrigerated capacity, but it's those regional and local partners that might not have that capacity, or they maybe have like a household refrigerator available at their pantries. And that creates inequitable distribution of food to the communities that can actually hold those foods. So we're not ensuring an equitable distribution of these frozen foods that people may want or need.
That's a great point. And food banks are going to try to move the food to the places that can take them. So as was mentioned, like if the charitable agencies do not have enough capacity, because capacity is a big issue, they don't have the capacity to take the food, then to prevent the food from being wasted, it's going to create problems of inequity within the distribution. And the goal for every food bank is to make sure there's fairness in distribution in the service areas that they support. So they are actively trying to find ways to increase capacity within their network so that their partner agencies can receive nutritious, frozen, healthy food.
The cold chain actually begins on the farm.
Yes.
Proper post-harvest handling for any fresh fruit and vegetable is absolutely maximum. We don't want to be calling the frozen folks with product that didn't get handled correctly. And so removing field heat immediately is just priority one for most growers of fresh fruits and vegetables. We've done a really great job here in the state of North Carolina of getting grant funding for some of our smaller farms that didn't have cold chain capacity to be able to install coolers. We've been working hard on getting those smaller and middle-sized distributors to also have refrigerated trucks so that we can maximize the temperature for the right temperature for the right product at the right time, and make sure that the products that are delivered to retail are the highest quality possible.
Yeah, and I'll just add validation for in real world is we don't have robust like company-wide donation programs. We rely on the everyday heroes in our stores. It's our store associates to have unique, special relationships with the communities that they serve with pickup agents, whether it's a local church, whether it's a local soup kitchen, or whether it's the larger food bank partner. And the issue for capacity is spot on across the board, is that we have food to donate. Unfortunately, what happens is a pickup agent will come to one of our stores. The store's super proud of all the donations they've collected, from frozen lean meats to fresh produce, et cetera. And then they show up in a little Honda Fit car and can only fit like 2 boxes of the 20 that are offered. And then when it gets back to, again, to the actual pantry or the church or the food bank, they have a household refrigerator that can't support. And then they end up throwing the food away, unfortunately, because it's highly perishable. So we do know, again, this is very regional and local. There are grants out there that help support some of these refrigeration capacities. So we would be looking more for partners that are in that space to, whether grants or donating larger, more commercial size refrigeration and freezer space.
And there are even federal grants and loan programs, like through the USDA, that we can just continue to funnel money into to work on these projects.
I love the fact that talking about refrigeration, which is not something I thought we would necessarily do, is such an important part of how the supply chain works. If this is not working for farmers, farmers are not able to earn the highest profit they could from the produce that they're producing. Otherwise, it has to go to some alternative market, if it even makes it there without proper cooling. The charitable food sector doesn't work if there's not proper cooling, and it's also a challenge for those small pantries who may have a household refrigerator, which is wonderful, but it's not enough. So I really appreciate how you all are seeing this and seeing these connections between how we can mitigate food loss and waste, which is a contributor to greenhouse gases, but it also helps farmers be profitable, but it helps the whole supply chain work. This is critical. I want to shift gears a little bit because we've talked a bit about food as medicine. And so this is a question for everyone. What are some of the challenges around food donation or the food as medicine program on farms or in the retail space? And how can we improve the infrastructure to serve these communities better? We've talked about cold chain. Are there some other ways of thinking about this?
So I'll kick it off if that's okay. So one of the things that, which are not like cool to talk about or no one really thinks about, at least from a retail perspective, is we actually have a lot of tech challenges. And tech meaning, so specific to food as medicine, there is so much great work out there right now with funneling funding through, we refer to it as healthy food benefits or healthy benefit cards, which are great because it makes a digital access to healthier, fresh, affordable foods, whether provided through healthcare funding or Medicaid, et cetera. But then they come into our stores and then that card doesn't work. So what happens we talk about silos a lot today, right? So what happens is there's all these folks with great, very well intentions, but they didn't follow it all the way through to what I refer to as the last mile of a food purchase, which is in store, which is still 65% of all food sales are still in brick and mortar stores, and then that card doesn't work. So you can imagine the checkout experience when the customer's there excited about their $20 in produce this week, and then unfortunately, maybe the associate's not educated on the program either, and they just simply say, doesn't work, or declined, something of that nature, and it's just mortifying for the customer, right? So then they're less likely to use it again. So that's something that we have to work on, and we're doing a lot of work behind the scenes on trying to bring these parties together so that we can all ensure we're on the same page, so that we can offer the best experience for the shopper so they can get their benefits. Another thing is going back to the shame and the dignity. And so I've been in the business for 28 years. I started as a bagger in one of our stores way back when. And I can remember when I was finally promoted to cashier, I was so excited. The amount of experiences that I had being on that end of the checkout when a customer would come up, and at that time they were still called food stamps, and they would have to lean in and whisper how they were paying. And that always chokes me up when I talk about it, because that always resonated with me, is that this person came in, this family of 3, 4, 5 children, and they had to whisper how they were paying for their food. And then, God forbid, they went over budget, and then we had to start taking things off. And then you get the huffing and puffing of customers behind them that are upset because they're I always pick the long line. So all these things we don't think of on a daily basis, but at that moment when they're just trying to get food to their family, it's the shame and the dignity and the undignified process sometimes of how we manage this at a retail environment. So we work a lot on that, whether it's through education awareness and all those things. But those are some of the challenges we face every day. So I would ask anybody, when you're in the store and you think you have the wrong line, just maybe show a little bit more patience for the transaction ahead of you, because you never know what someone's going through.
Thank you. And I'd like to add to that, that I think, farmers are partners in this whole process, and we need to start treating them equally like they are a partner. We heard from our prior speaker on labor that we're seeing more and more imports. American fresh fruit and vegetable producers, their market share for the U.S. market of fresh produce is expected to decline by 2.1% every year for the next 10 years. That's just out in the USDA report. That's not how we need to be treating our number one partner that provides healthy fresh fruits and vegetables, right?
Yeah.
All farmers need land, they need labor, and they need a rational regulatory system in order to operate. That gives them the tools that they need to be able to jiggle whatever they have around them to make a profit. And I want to give you an idea on the land piece. So here in North Carolina, we have about 8 million acres that are in farmland. American Farmland Trust estimates that over the next few years, by 2050, we're going to lose 1 to 2 million acres of farmland to development. Now, I want to give you an idea of the 129 acres in northern Durham County. That's a great incubator farm. I'm so excited that Durham County has decided that they want to foster farmers coming in. But the state of North Carolina has lost 100,000 acres to solar panels in just the past few years. My county president in Washington County, we were on the phone on Friday, and he said, yeah, Debbie, I'm surrounded by solar panels right now. Some of the prime farmland on the East Coast with the Castle Hayne Aquifer underneath, so we have water that California does not have to produce fruits and vegetables, and we're putting solar panels on that land. It's an economic decision, but still, as a country, we're not valuing the farmer for the partner that the farm and the farmer really is in this whole discussion.
Yeah, thank you. Yeah, I wanted to add something about the food as medicine. So from a supply chain perspective and from the charitable food assistance sector. So very quickly, just wanted to say food banks are nonprofit organizations. They rely heavily on volunteers, right? And so any type of additional programs, such like, senior boxes or working in a food as medicine, it requires volunteer support, not only to prepare the boxes, but also to deliver. So there's as we talked about cold chain capacity, we also need to consider processing capacity, human, material, labor constraints, those kind of things that affect the ability of food banks to actually distribute as much food to people that they would like to.
And I'll round it out on the food as medicine conversation. I really think that we should focus on parity between fresh and frozen and other forms of fruits and vegetables. In today's conference, I've heard people overemphasizing how we need to get people access to fresh fruits and vegetables. But like I said before, nutritional equivalency across fresh and frozen vegetables. They are picked from the field, they are transported in their cold chain infrastructure, and they are often frozen within minutes, locking in those nutrients and the great taste, quality, and all those things. So currently, produce prescription is limited to fresh-only fruits and vegetables. And when we look at GusNIP, which is the nutrition incentive like Double Up Bucks, it overwhelmingly prioritizes fresh fruits and vegetables over other forms, with 86% of grant funding last year going to fresh-only programs. And then, of course, we talk about WIC, where states have to elect to offer other forms. They're required to offer fresh fruits and vegetables. They have to elect to offer other forms. And there's 3 that do not allow frozen to be sold through the WIC benefit. So we need to ensure that people have choice in the matter and get to have what they need to have their family, eat more produce. We have that produce consumption gap. So I really think focusing on the all forms messaging across nutrition communication is important.
Thank you. What this conversation is helping me to appreciate is, there's some policy change that can be enacted to improve our circumstances, but there are some trade-offs that we're making. And as long as if we do not recognize those trade-offs, we're failing to actually make the best decisions. And so I think we're near at the end of our time, and I would love to hear, just as many of you who can contribute to this, how do we enact even just the smallest change to help us address how to make our food system more sustainable? And I mean it in the broadest sense possible. We got 30 seconds.
So for me, it's as simple as choices. So we have to allow people to make the choices that are best for them and their family. So the more that we focus on do this, not that, guess what? We want to do the opposite. So we firmly believe all foods fit, and Jennifer just mentioned that as well. And when you start, it's nudging behaviors towards whether it's the healthier products or the more sustainable products. But shaming and kind of finger pointing, that's not the way to make sustainable change. So that's what we stand on, and that's how we educate our customers and our associates.
Great. Well, we're at the end of, let's thank our panel.
Everyone, bigger. Norbert is a rock star. He allowed me to have a bio break. I can't be more grateful. Thank you again to all of the panelists. So we have one more panel that will be focused on what's happening to strengthen food retail spaces. Joining me in the conversation will be Ken Kolb, a professor and chair of the sociology department at Furman University. Sean Cash, a professor in global nutrition at the Friedman School of Nutrition Science and Policy at Tufts University, which is where I went to school. Maggie Funkhauser, the manager of the Carbaro Farmers Market and board chair of the North Carolina Farmers Market Network, and Luke Saunders, the CEO and founder of Farmers Fridge. Before our conversation begins, we're going to share two videos. The first is from Congress member Jeff Jackson, who represents North Carolina's 14th congressional district, and we'll hear from U.S. Congress member Don Davis, who represents the state's 1st district. Enjoy the videos.
Hi, Duke. Hi, Food Tank. Good to see you both. Sorry I can't be with you in person. Just wanted to say thank you. I think you all do fantastic work, but right now, in the middle of a big budget debate, I think it's really timely and really essential. The danger in this debate is that when we talk about things like WIC and SNAP and the child tax credit, that we reduce those things to lines on a budget or lines on a spreadsheet. And their lives, very often the lives of children. And we have to make sure that we're humanizing the impact of different policy proposals that folks are kicking around. I think both of y'all, both of these organizations, do a wonderful job of that. And I'm really proud to be able to work with you and partner with you. I got a year left in Congress. I want to do as much good work as I can, and I want that to involve these two wonderful organizations.
Hi, I'm Congressman Don Davis, proudly representing North Carolina's 1st Congressional District. It's a pleasure to join you virtually at the Empowering Eaters Summit to discuss a topic close to my heart, the intersection of food security and environmental sustainability. We're at a point where the choices we make now seriously impact the future of our planet. It's not just about having food on our tables, it's about how we get it there and what that means for our world. Food security isn't just about having meals, it's also about doing it in a way that also protects our planet. As we address food security, we must adopt practices that not only feed our growing population, but also safeguard our environment for generations to come. Farmers in eastern North Carolina are already stepping up, using methods like agroecology and precision farming. These aren't just fancy words, they are ways of farming that help the soil and save water while safeguarding our planet. And guess what? There are fantastic local projects happening, like tackling food deserts, setting up farmers markets, and supporting community gardens. It's all about making sure everyone can get good local food. Thank you, Empowering Eaters Summit, for bringing us together to discuss these critical issues. Let's cultivate a future where everyone in eastern North Carolina and beyond has access to nourishing food and our planet thrives in harmony.
I loved all those videos. I thought they were so great. I want to thank all of our panelists for joining us. Give them a bigger round of applause, please. Sean, if we don't mind, I'd like to start with you and talk about dollar stores. They're popping up around the country. They're all over Baltimore, where I live. They get a lot of criticism, but they are also important for communities' access to food. So how are consumers, how are eaters using them in a strategic way?
Thank you very much for that question. So a big part of the work that my colleagues and I have been doing at Tufts has been looking at some of the ways in which the environments in which we purchase food have been changing. And dollar stores are one of the most dramatic parts of that. Across the country, we've been looking at scanner data, kind of detailed information on what people are buying and where they're buying it. And the role of traditional grocery stores in terms of where we're spending our food dollars has dropped quite a bit over the past decade. About 4% nationally, but double that rate in rural areas. Mm-hmm. And dollar stores are one of those other retail channels that have really been growing at the same time that some of these other changes are happening. When you walk into a dollar store, you see that there's definitely a different mix of food than you might expect to see at a grocery store or other places. Many of times there's a lot of things that we want to see that we don't see there. But the people who shop at dollar stores really like shopping at dollar stores. Some colleagues of ours at the Center for Science and Public Interest just released a report a few months ago, and that high level of satisfaction with dollar stores is an interesting finding in some of their work. So in the work we've been doing, we've seen that folks who are buying things at dollar stores, indeed, those food items are on average less healthy than the things they might buy in traditional grocery stores or some of the other formats that have wider varieties. But at the same time, those households that are spending more of their food dollar at dollar stores are also sometimes buying, or often buying, healthier things in other places where they're spending their money. So I think these nuances are really important when we think about how we have policies and interventions to try to encourage healthier eating. We want to make sure that we're doing everything we can to increase access to healthier food, but maybe we also want to be cautious about policies that are going to put constraints on households that are already working really hard to do the best they can in the environments in which they're accessing food.
Thank you so much for explaining those nuances. I'm wondering if in your research you're finding a willingness or an ability for dollar stores to change a little, here and there.
I can't comment on the conversations that they might be having inside their boardrooms and planning, but the dollar store model really relies on what you might call long distribution chains. So the same things that have made them so successful competitively in the landscape are some of the things that I suspect internally are real challenges for some of the increased stocking of healthier food items that people might like to see. That doesn't mean that we should let anyone off the hook and shouldn't be still having those conversations. I also think there's a lot of opportunities for communities and other programs to think about how the patterns of where people are going to buy food, how that fits in with people's time use and patterns, how there might be opportunities for also increasing access to food in the areas where dollar stores have been so successful at locating.
If only I could be a fly on the wall in that boardroom. Ken, if I can turn to you. When we last spoke, you mentioned that bringing food closer to people is only part of the equation when we're addressing food insecurity. And you said that we also must understand household dynamics and time constraints that eaters face. And we've dug into that a little bit today, but I don't think people truly understand the time constraints that people who are living in underserved or marginalized communities, or who are not the people in this room, to be quite frank, what they're facing every day.
Yeah, thank you for that. I mean, it's in my research, when I sit at people's kitchen tables on their front porches, asking them questions about where they shop, where they get their food, it becomes quite clear that being poor just takes forever. There's just the litany of tasks and chores and hoops that you have to go through really put some time constraints, and that people, even if they're close to a grocery store that sells healthy foods, they're time starved. And so the economy of scale of home cooking within the home really depends on a number of factors. What I found was that it was the number of adults in the house with the same tastes who were there at the same time really made a trip to the store to bring food home, to cook and prepare it as a meal. That's what it took to make things work. The problem is that we're facing some serious demographic trends. In the United States, in the past 60 years, average household size has dropped from 3.3 to 2.6. 1 in 7 American adults lives alone. under those situations, even if you can get access to a head of lettuce or a head of broccoli, that can be a headache, because what are you going to do with that every single day for the next couple of days? So to meet customers where they are, to find ways to make home cooking work, we need to account for those household dynamics so that they can realistically make up for the time gap that their other constraints are placing on them.
That isolation, when we talked about it before today, is so key to this. And I think it's something that maybe policymakers are forgetting, that, you know, households have really changed. How do you want to, you have this forum, how do you want to communicate that to them?
Well, I think if we can just identify the everyday realities, what are the economies of scale of home cooking to make it work, and to incorporate into interventions ways that can reduce the time constraints on family. So this is cooking is one part, but it's the shopping and the chopping and the cutting and the preparing and the recipe making, all these things that can also be done by other agencies. So if other agencies can help families prepare and work in unison to create sort of meal kits that can take advantage of wholesale food pricing, cut down on some of the time constraints when it comes to making the meals work at home. Anything that you can do that can just address the time bind that people are in, that they want to eat healthy, and even if they can access it, and even if they can afford it, there's still, those household dynamics still might block them from being able to prepare it inside the home.
Yeah, and it could cut food waste too, which was talked about in the last panel. It's such an interesting dynamic. Luke, I want to turn to you, because as somebody who's a part of the private sector, you've done such a great job of a lot of things. But the first one I want to talk about is helping eaters access fresh foods, really healthy foods, delicious foods, when their time is limited, like we've been talking about. What does that look like for you as a company?
So time, we recognized a while ago that that's one of the biggest factors. If you make $10 an hour and you have to spend an hour making your healthy meal, that it just costs you twice as much as a fast food option. So for those of you who don't know, Farmer's Fridge puts food in vending machines. We operate in 22 markets across the country. And our whole mission is to make fresh, healthy food as accessible as a candy bar. So the idea that it could take 2 seconds, you walk up, you buy something, you can go and it's ready to eat right there, was really why we got started. But it's also like in the middle of the night, 24 hours a day, so you don't have to worry about having to shut down. So that's another thing we hear all the time, is people in a hospital in the middle of the night wanted something healthy to eat. We're the only option, but time is probably the #1 thing our customers have in common.
My co-founder, Bernie Pollack, his wife is a nurse, and she depends on you daily. So thank you for that. I appreciate it. And a lot of frontline workers depend on Farmer's Fridge. Maggie, I want to turn to you, and I sort of had a different question for you, but I want to talk to you about this time issue first, because farmers don't have a lot of time. And when you're at the farmer's market, I've worked at a couple in the past, a million years ago, it's a rush, rush, rush. So I guess here's what I want to ask. There are a lot of farmers who are doing like added value, or value added foods, right? Some salads, I've seen that kind of thing. That's difficult though, if you're a farmer who's working every day in the field and then have to have the proper processing and that kind of thing. So what is your advice for farmers who want to have value added foods at the farmer's market but are facing a ton of constraints? And if you can't answer it, I'll ask you the question that I had before, which I also will anyway.
Yeah. No, I think that is a good question, and my panel mates might have a different perspective too. I think value-added foods are very popular, especially at the local level at farmers markets. Think like a strawberry farmer who wants to make a value-added jam or something like that, and it provides an additional margin, I guess you could say, for that product. But there is a level that business has to be to kind of accommodate that separate product. Additionally, they would have to have facilities of some kind. Right. They would have to have like a workflow to ensure food safety, that sort of thing. So,
this infrastructure issue is a real one that
sure.
we've talked about all day. So there's transport, there's facilities, there's these regulations and hoops for food safety that rightly farmers have to go through. It's just a lot. So I'm wondering now if I can talk to you about how the producers you're working with through farmers markets are working to address that food access at a local level? Because that's another problem often for farmers, to jump through those SNAP hoops.
Yes, and I'm so excited that a lot of folks have brought up food access at the farmers market level. Big thank you to Mayor Williams for bringing up our Double Bucks program, which I'll just kind of touch on. So in the past 10 or 15 years, farmers markets in North Carolina and across the country have really made an effort to not only accept SNAP, but offer an additional incentive, which is called different things depending on where you live. In the Triangle, the farmers markets in Orange and Durham counties have a collective that we call it Double Bucks. And for our farmers markets, it's a true dollar-for-dollar match that is unlimited. So if someone comes to use their EBT card, they want to use $20 at the farmers market off their EBT card, we'll give them an additional $20 that they can also spend on a SNAP-eligible item, not just fruits and vegetables, which is somewhat unique. Many will offer a cap up to a certain amount, and only for fruits and vegetables, for example. So we are really, really lucky to be able to provide the service unlimited. So, if you want to get $200 off your EBT card, we'll give you $400 to spend at the farmers market. So, and for our farmers at the Carver Farmers Market, all of our vendors who offer a SNAP-eligible item will accept those benefits. And the way that farmers markets accept SNAP is often a little bit funny. We, as the farmers market, so the Carver Farmers Market is a nonprofit, we are the one with the FNS license, and so we accept those benefits, and then we represent those dollars with a currency that can be used among the vendors. And this is significant. It allows farmers markets to be able to offer this service and not put the burden of the license on the individual farmers. That can be complicated and expensive, just more barriers for them as producers.
It's like great local economy, very local economy. That farmers market is its own economy, and I love that.
For sure. And for our SNAP program, we offer Double Bucks for not only for SNAP, but also for the North Carolina Farmers Market Nutrition Program, which is a seasonal benefit that's offered for WIC participants as well as seniors who qualify on the basis of income. And we also offer a cash match. I know WIC has come up, so I wanted to just shout out to the way farmers markets can help with WIC. We, if someone wants to use their eWIC card, we can't actually process it, but if they can show it to us, we'll accept cash and double it. So that's one way we try to make the farmers market accessible for WIC families too.
Thank you so much for making that all very clear. Sean, I want to go from farmers markets to online grocery shopping, which many folks did not do until 2020 hit and changed the world. You're trying to make it easier for consumers who are shopping for groceries online to understand the nutritional benefits or the nutritional value, I think is the term you use, of the foods that you're choosing. But a lot of these online labels are very confusing. They're not consistent. I know FDA is trying to change that. What would you like to see happen?
Thanks. And just take a step back when we're talking about online grocery and online food access. This is not a niche thing anymore, right? According to USDA, 80% of Americans bought food in some way online last year and in a given year. 20% of Americans report that it's a regular part of their habits and ways of getting food. And we're talking about online grocery delivery, or also its close cousin, ordering the things online and then going and picking it up at a grocer or another retailer. Also buying things in other channels online, and then finally prepared food delivery, thinking about Uber Eats, DoorDash, companies like that. And in all of these platforms, what we have not seen is the sharing and provision of required information, things that we normally expect to see when we're walking into a conventional store. Things like the ingredient list, the nutrition facts panel, allergen disclosures. We are not seeing these things consistently provided in these online environments. And to date, there's not really a clear requirement that they be provided. Why is this important? Because this information does matter. At the population health level, people do better when they have more information, right? It's a small but important part of how we might help encourage healthier choices and healthier outcomes. The other reason why this is a concern is not just that people can't necessarily easily access this when they're choosing the food, but in the absence of requiring things like a nutrition facts panel or an ingredient list, that what you see instead is other information, designed to sell us food rather than tell us about our food. And so in some of the studies we've been doing, we really see that's what's proliferating. There's a lot more of this voluntary information and marketing type language, what's sometimes called the romance copy, and you just can't always or consistently find the information you would normally expect to see on a package of food, or calorie disclosures in a restaurant not showing up in a third-party platform.
Sure, and I've also found it interesting for me, who often shops online, that it represents sometimes a time constraint that I didn't expect, because I have to go Google what is in this actually and how much salt, whatever. Like that's another time constraint for folks.
Yeah, and the opportunity for this is definitely not being realized, because we know that in so many other areas of our lives, online tools are ways that connect us with information and allow us to personalize the things we're searching for. So personally, I would love to see, whether it's voluntary or mandatory, more things that if I'm concerned about added sugar or sodium or trying to avoid certain allergens, that I should be able to set up as a consumer those search filters. There have been moves to, there are regulatory actions that the relevant agencies can take. I don't think we have time to talk about all that today. There have been some moves also to have new legislation to clarify this requirement. The issue with that is that there's been really great stuff that would close the loop on these online issues that have been proposed as part of the Food Labeling Modernization Act proposals that have gone in consistently year after year. But there's a lot of other things that those bills include, and given the politics that we face today, large overhaul bills face more opposition. So, and again, I think that this online grocery thing and saying, hey, the information you get in that you've got in places under 20th century laws and 20th century environments should also apply to these more novel environments. I would hope that's a nonpartisan issue and that we can find a way to close those gaps.
I would hope so too. Thank you so much, Sean. Ken, if I can come back to you, I'm interested in hearing from you, what other opportunities do you see in the retail space or at the policy level to help ensure that eaters are not just food secure, like getting enough calories, that's just not enough anymore, right? But that they're nutrition secure.
Well, I think it's a targeted approach to try and find out the populations that we're trying to reach. So there's some folks where we're just trying to get them up to a bare minimum, okay, of meeting their basic nutritional needs. And then there's another group of folks who are just kind of hanging on, okay? We can think about they're a family of 4 living just above the poverty line, maybe $28,000 a year. For them, a flat tire or a sick kid can just derail everything. It can spiral down. And then you need food assistance. You don't really have total control and autonomy over what you're eating. And then there's a group that's kind of hovering a little bit above, let's say, 150% of the poverty line, maybe $35,000 a year for a family of 4. They're in a position where they have their basic needs met. They have a chance to explore and try out new foods. But the risks are still really high, because the risk of refusal for healthy foods, especially for families with children, are really acute. So you can think about, we were talking earlier in the green room that my daughter's first year of her life was 100 yards away from the Carborough's Farmers Market. And so we spent a lot of time trying to introduce new and foreign foods, healthy foods, dark greens, bitter foods. Kids have natural aversions to those. They don't want to eat them upon first try. You need to introduce it to them time after time after time, and they may refuse it time after time after time until eventually you can get them to adopt and acquire some of those tastes. But that's an expensive process.
It's a luxury, right?
It's a luxury. And so the economic constraints of I can just meet my basic needs to the point where I can now afford the risk to acquire new and healthier lifelong tastes that can stay with us, to get kids to be able to acquire and adopt those embodied tastes to where it's not just like they're faking it, okay, Mom, I like it. It's that they really do appreciate it. That costs a lot. And so it takes money to get people to like healthy food. And that's something I think we need to acknowledge.
And we don't have a marketing campaign for that, or a lobby. Yeah, thank you for all of that. Maggie and Luke, if I can turn to you, we talked about the power of procurement earlier, and I think this is such a huge thing, because to make food systems healthy and sustainable for all, that means that farmers are able to grow foods that are nutritious, and delicious. And I'm wondering how you both think about the procurement process and what it means. So if you can talk about what Farmer's Fridge does first, and then I'll turn to Maggie.
So one of the principles behind Farmer's Fridge was fresh, healthy food is a lot of fruits and vegetables. It's like the one thing everybody agrees on makes you healthier. So we actually make all the food in one place. What this allows us to do is buy a lot more food directly from our farmer partners. So we actually just graduated to the level of scale where we're like skipping the Cisco and the US Food step and able to get food directly in. It allows us to get higher quality ingredients, better shelf life for our customers, things like that. So I think just being able to aggregate that demand is a big part of how we thought about it from the beginning, which is more traditional CPG. You were hearing earlier a conversation about negotiating with farms and farmers and farm workers. Like that's the aspiration that we had, is if you can be moving the market for pickles and tomatoes, but you're doing it for salads, which we carry 150 ingredients in our pantry. That's how you really positively impact the food system and also improve human health. So it's that virtuous cycle.
And that aggregation has really helped you scale over the last decade and some change.
Yeah, it's a huge part of how we keep the food affordable and higher quality, and it actually gets better in step functions. So the food will get cheaper as we get bigger as a result.
Maggie, how do you work with, I mean, you're working with small farms. Some are probably bigger than others. Some are working with restaurants and cooperatives and local grocery stores. How do you sort of manage that procurement process and help them, get bigger markets, get different markets?
Yeah, so I'm also here representing the North Carolina Farmers Market Network. We're a somewhat brand new nonprofit. So, we are composed of a lot of what are called producers-only farmers markets, meaning that the folks that are present at the businesses represented are the ones who grew or produced the food that is there. And so we in Carrboro are also producers-only farmers market. So one thing that I think is interesting, we work mostly with small and mid-sized farmers, fewer like larger and conventional farmers. And one thing, especially in the Triangle, we have such a rich local food ethic and local food economy, and a lot of our farmers, their business plan is to sell direct sales at farmers markets. That is the business plan, and that is like a totally viable business plan. In North Carolina, there are about 200 farmers markets across the state. We have a huge direct-to-consumer local food economy that is here. So, for our farmers, a lot of them have really built their businesses on selling direct to consumer at local farmers markets. And so for me, it's about making sure that remains viable for them so that they can continue to do it and maybe push past the 2-year mark, the 5-year mark, and really get into the long-term viability.
That's great. That's so interesting. Thank you. Sean and Ken, I'm going to end with you because I think that, the research you're both doing is so important, but we know that there are research gaps that exist that are really crucial to making sure that folks are food and nutrition secure. Any calls to action on what should be invested in, either from land grants or from private universities or the private sector?
Well, I've got an idea. And so I think what we can, the resources we can harness from local farmers and local food, fresh food, that it's hard to make it closer and cheaper to people who need it the most. They're often in communities that are inundated with dollar stores. But, however, I think that we can partner and pair these resources, that if we could bring healthy, fresh foods into the parking lots of dollar stores, honestly, through food assistance programs, USDA GusNIP, the former Farmers to Families program, all these healthy food boxes, if we could leverage the food assistance programs to bring those boxes to the parking lots of dollar stores, you could pair two mutually complementary resources. Dollar stores sell non-perishable, canned goods. So they have a dairy case, a deli case, a frozen case. Those healthy food boxes are filled. There's no SKU in that box that competes with what's inside that store. It could bring customers to the store. Everybody needs toilet paper. And so if you get asking people to go to the place where you're doing your shopping already, and yet you can harness or leverage existing assistance resources, you don't require an extra trip of people. You can save them time, you can save them money. and it doesn't actually require building a whole new infrastructure.
Brilliant, love it. Sean, as a member of the Tufts Mafia, you get the last word.
I agree with Ken's idea here, and in terms of the calls for research, I just think, and based on the conversations we've been having here today so far, that the type of research that I think is most meaningful is that research that helps connect people's lived experiences, really understanding where they are and the challenges they face in their own lives when we're thinking about the household and consumer part of this, and trying to connect that, whether it be through large data sources and other things, to all the things we're trying to do large scale when we're having national conversations about policies and programs. It's hard for me as a researcher to keep that in mind. I think it's hard for all of us in our day-to-day jobs to do, but that's the bottom line for food systems. We need to meet people where they are and still think about where we need to go as a country.
Excellent final point. Thank you so much. Please give them a round of applause. Thank you all. As we're setting up for this final keynote, which I'm really excited about, I want to thank you all as an audience. I'll thank you again. I know it's a Sunday. I know it's nice outside. I know that you probably have families and friends that you could be with. I just want to thank you all so much for being here today. It means a lot to me. I've only been to North Carolina a few times, and I go through the airport a lot, but this has just been an extraordinary audience, and I want to thank you all. I was talking to some folks in the women's bathroom, and those are where the best conversations have, my male friends. So I want to thank you all again. Please give yourselves a round of applause. So as I said, I'm really excited for this final fireside chat. It's my honor, my true honor, to welcome author, chef, educator, and advocate Sean Sherman to join me on stage. Round of applause. Sean is the founder of the Sous Chef, co-founder of Natives, and co-founder of the restaurant Owamni. It's so good. Please go when you're in Minneapolis. Try to get on the reservation list, though, now. He is also last year's Julia Child Prize Award winner and has won numerous James Beard Awards. Yes, okay. Thank you so much for being here. Another round of applause, please. We got to keep the energy up. We still have a reception and breakouts and lots of things to do. So, Sean, your work to repair food systems has been so important because it focuses on undoing a lot of terrible things that have happened because of the impacts of colonization, and also reintroducing traditional indigenous foods that are delicious but have been lost in so many regions and communities. Can you talk more? We heard about Natives earlier today. Can you talk more about Natives in the Indigenous Food Lab?
Yeah. So Natives, or North American Traditional Indigenous Food Systems, which is a mouthful, is our nonprofit. We're a 501c3 based in Minneapolis, Minnesota. In Minneapolis, we have a public-facing entity called the Indigenous Food Lab, where there's a market space where we feature over 50 different producers and growing. And we're just putting a lot of attention on these indigenous producers from all over the place. We have a classroom space where we outfitted it with lots of digital capabilities, so we're recording a whole bunch of education and classes on all sorts of indigenous food, everything, and just indigenous education in general, you know. So it's more than culinary, but it's also seed saving and farming and language and star knowledge and crafting and anything we want it to be. But we're really just trying to focus on creating more indigenous education access. And part of that is is just thinking ahead, like, because we're creating a lot of food access, but sometimes if we give somebody a bag of dried corn, they're not going to know what to do with it. So our goal is to create that education and make it really easy and accessible so people can just hit a QR code, go straight to a video, and start to learn about some of these pieces. We also have a big production kitchen where we make a lot of products. We do a lot of value-added things. We got USDA licensing to try to be a micro to medium-sized co-packer to try to help get people or more cottage industry out there on the market. And so we just finished a pilot project with an indigenous baby food where a local indigenous organization grew a whole bunch of native heirloom squash and harvested wild rice, and we processed it all into a really beautiful baby food called Indigibaby. And then the restaurant's actually a part of our nonprofit model also, because the restaurant is owned by the nonprofit. The restaurant acts as a place not for food relief and food access, but a place where job creation happens, because we've got over 100 employees at the restaurant right now in the middle of winter, even though it feels like spring.
Right, right.
And we are just moving tens of thousands of dollars directly into the hands of indigenous food producers, because we're doing about $5.5 million in sales at that restaurant, because it's very popular.
That's
You know, we won
incredible.
Best New Restaurant in the entire nation a couple of years ago, and that was big. But because of that, a large part of that's food costs, and a large part of that food cost goes directly in the hands of the indigenous producers that we're utilizing. And the restaurant just creates a voice for us, because we're popularizing healthy food without having to call it popular, and we're showcasing so many more products out there that, because of our focus of basically trying to decolonize our food system, is looking at the values that colonization has normalized in our lives, which we've seen a lot of normalization of the destruction of environment, a lot of dehumanization of people of color, and so many other things that have negative effects, especially on communities of color. And for indigenous peoples to have lived in such invisibility for so long, still today, and our food systems to be completely shattered and an afterthought at best, that there's so much work to do. Because myself, growing up on Pine Ridge Reservation in South Dakota, which is the third largest reservation, you know, we had the one grocery store to service an area the size of Connecticut. And I primarily grew up with commodity food program through USDA. And there's a lot of changes that have to happen. So that's what we're hoping to do. But basically with natives, we're wanting to replicate that whole model, which is a hub and spoke, because we're just creating something to work with all of the tribal communities around us to help build more capacity for culinary and just food access in general by getting these foods directly into those communities, and then doing that everywhere. So this year we're getting ready to move into the Montana region, so we're centering ourselves in Bozeman with Montana State, and we're going to do the same thing of just setting up that. But we're also got seeds planted in Anchorage, Alaska, in Honolulu, in Rapid City, South Dakota, in Tulsa, and we're just going to keep building support systems all over the place. And that's kind of the bigger vision, and eventually crossing colonial borders, because we can do the same work in Canada or Mexico or wherever. Like, there's so much opportunity out there.
A beautiful web that you are spreading and building. Thank you so much for that. I want to talk about resilience, because that's so important to the work that you do. And I was thrilled that Congress members mentioned resilience in their videos today. How does the empowerment of Native communities help, to grow, forage, and process food, build resilience, not just for them as communities, but for environmental sustainability?
Well, when we're looking at indigenous values around food systems, it's really community-based, because people of color, primarily all over the world, we're a community-based food system. So everybody works really hard to make sure that the entire community had food, and any surplus would get traded from other groups out there.
Right.
And so it's looking at a different way to think about that, but also within indigenous values, there's a deep connection to the environment, to the plants, to just the region in general. And that deep connection helps us protect that, because like we care about the water, we care about the plants, we care about the land, and there's so much deep connection, because we know that we're a part of all this. And if we destroy that, that's going to hurt us, which colonization has normalized, is just so much rampant destruction and just the privatization of land spaces and making it really difficult to have land access out there. But we need land to grow food, So I do a lot of speaking engagements, obviously, and I always tell people lawns are stupid, for an example, because we should be just growing food everywhere.
Yeah.
We should be a lot smarter about our environments, and we should be a lot smarter about the kinds of seeds that are out there and how we're going to continue the lifespan and life cycle of those heirloom varietals out there, and to really fight against a lot of these big groups that are trying to trademark a lot of these heirloom seeds for the sole purpose of gaining power to control your foods,
Absolutely. Thank you for that, Sean. One of the things I'm interested in asking you about, and it's kind of a difficult question for me to ask, because there's this growing food as medicine movement that, I think so many of us are sort of finding out about for the first time, but it's something that indigenous folks have practiced for millennia. It was, of course, food is part of keeping yourself healthy. I'm wondering, I guess, do you feel that it overlooks what indigenous communities have been doing and sort of co-ops it? Like regenerative agriculture, the term makes me feel uncomfortable, and I have to be very honest about it, because it's what indigenous folks have always done.
Yeah, but I feel like there is some co-opting that happens a lot of times, and we see that with, Western-centric academia will, use TEK as a term and just popularize that. Now it's food as medicine because it's a little bit easier to understand. But, it's just it's built into so many indigenous cultures across the globe, So we look at colonization as something that's affected everybody. It's just North America, South America, Africa, India, Southeast Asia, Australia, New Zealand, Hawaii, you name it, colonization has happened all over the place, and it's shattered so much of our own ancestry and so much of our own knowledge around food systems when it comes down to it. But if we're looking at, again, how indigenous communities on a global scale were surviving through their food systems, there's so much amazing education and practices that can come out of that. And so food as medicine is something that's just built in because it's preventative. It's like knowing for sure we're eating unhealthy, because like with our method of just cutting out all colonial ingredients and just showcasing what are true foods in North America, and on top of that, very regional foods, that everything in our restaurant is completely gluten-free, dairy-free, sugar-free, soy-free, pork-free, right? It's just not free, but it can be. But it's really like we're popularizing healthy foods without calling it healthy, and we're doing it in a manner that's really getting people to be excited about what is native food. But on top of that, there's a lot of interest outside of just the native communities because we're showcasing that we can utilize a lot more plant products, and there's a lot more products that could be made regionally that the Western diet's just completely ignored in North America, and there's just so much more out there.
Right, and we're missing it all, and it could add so much richness to all of our lives. And so thank you for the reminder. I feel like, you talked about the invisibility that has happened for Indigenous folks for millennia, right? It's only now in recent years that Indigenous folks are getting the attention that they deserve for the work and conservation and stewardship and culinary practices and all that they have done, and just the intensive knowledge that they have. And, one of the things that I think is problematic is our philanthropic sort of model. And what folks like you need is more capital and investment, but the system is set up in such a way that it's not always, communities aren't always able to, spend months filling out grants or hire consultants to help them do that. What would you like to change in sort of that philanthropic model? What needs to change, and how do we need to look at philanthropy in the future?
Well, I feel like, I'm an executive director of my nonprofit, and it is difficult to try and find funds, especially when we have this huge vision, and we see so much philanthropic dollars going to these larger organizations that have just been out there for forever and just taking up huge chunks of that philanthropy, And I feel like during the pandemic and during George Floyd that we saw a lot of support going to a lot of organizations of color, but we kind of feel like that kind of support's not as prevalent as it was before, And like we have this massive vision, and we need monies to be able to lay out this infrastructure because we're just trying to create an infrastructure that doesn't exist. And it's really important that this happens because, we have been invisible for so long. Like this year in 2024, that marks a century that we actually were allowed to be citizens in this country, which isn't that long ago. It's only been 35 years since we've been allowed to celebrate our own religions here in a country that goes on about freedom of religion, just didn't apply to the First Nations people. So there's so much to unpack because of this, and so much damage has happened to our cultures because of racism, because of the normalization of what colonization brought to us. And there's just a lot to do, and we see other organizations, other Native organizations, that are trying to do some big work, but we're just trying to make changes because the status quo has been our invisibility for way too long. But we have so much to offer. We have so much diversity because Native America isn't one unit. It's a tapestry of so much diversity, and we should be celebrating that diversity and really truly understanding how this makes all of our regions separate and how many amazing, beautiful products can come out of all these different areas. And we could just be eating healthier if we just chose to eat like indigenous peoples of North America.
And it's more delicious.
So delicious, yeah, and it's so much fun, And we don't have to be stuck in the past and trying to create museum pieces of what we were eating 300 years ago. What we're doing is modernizing it and moving moving forward, because we have the ability to change and we have to evolve as humans no matter what. And because climate change is happening in real time, because we literally just tapped maple 3 weeks ago, which is 3 weeks way too early, and that can't be a good sign. But we have no choice but to be resilient and to roll with this, but we have to be smarter. We have to protect water, we have to protect land, we have to stop just allowing a lot of this access, because there's still companies like Pepsi that just buy up so much water just for the sole purpose of making plastic bottles.
Right. So since we're at this conference and there's something big happening in North Carolina on Tuesday, I forget what it is, and it's an election year, what would you like to happen from, what would you like to happen from state governments first and then the federal government?
Well, I mean, I think, again, like, we really have to rethink our food systems. I think that, there should be a lot more policy and practice of growing foods. I think if one city just took a big empty area where there's just an empty lot or lawn or whatever, and they can turn that into a food forest, and they can use that food forest to grow lots of diverse products, and they can use it as an education piece. They can get volunteers to process all those products and to preserve them and to make a large pantry that could be used against food relief. And just like a 2-acre lot could pump out a lot of food, and I feel like there's a lot of little things that we can do, again, but we need more diverse growing systems. We need a lot more education around growing systems, and we need to just get the kids hands-on, with their hands in the dirt and their hands growing and picking fruit from trees and whatever it takes. But that's the kind of education we need, and that's just not the education we're getting, because if we're going to high school in America, like, we don't learn about history, we don't learn about self-sustainability, we don't learn about finances. Like, what do we learn? I don't know.
Not sure.
Calculus sure helped me, I guess. I don't know.
Not me. I didn't do well. But no, I mean, I guess, in terms of what's next for you and natives, what do you see happening over the next year, 2 years, 3 years?
Yeah, I mean, our vision is we're just moving as a nonprofit. We're just starting our expansion phase, because now we have this full model built in Minnesota, and we're going to start working regionally around us with all the tribes, but we're going to start these other pinpoints in Montana and Alaska, and we're just going to see this growth. So we can see Montana happening in the next 1 to 2 years. We can see Alaska happening in the next 2 to 5 years, and we can start, we always thought, like, as a chef and as a restaurant, somebody who grew up in the restaurants, watching some of these fast food places opening up like 300 units of Five Guys burgers and fries in like a 2-year period. So, like, can we use some kind of replication growth process, but to do it for food, to do it for the sake of food access, for food education, and like, can we replicate like that? And I think we can, and that's our vision, is just creating something that's going to grow faster and faster and faster and more and more and more. So right now we're just learning the lessons of what it's going to take to expand ourselves outwards, but again, just laying out really necessary foundational structures for the next generation. And I'm hoping this work goes beyond my lifetime, because I feel like I'm turning 50 in a couple of weeks.
No.
Yeah, so I feel like I have X amount of years to actually do this work, because Mecca and I want to disappear on a Bleach and Belize eventually, but we want to be able to leave something in a legacy for the next generation, and that's the best thing we can do in our lifetimes, is set up the next generation for success.
And that's what you're doing. You're making me cry, Sean, because I can't believe you're 50, but call to action for this audience and everyone in here.
I think that we should really learn about the histories of the land that we're on. I think we should fight to protect our histories, because we're in a weird world right now where our Black and Indigenous histories are being completely removed, and I think we should be standing up against that with everything we can. And we should be learning from as much as we can to dismantle what colonialism has normalized, So I think learning history is a hugely important piece to everything. But again, just practicing food, learning the plants, go outside, stop calling everything a weed, but actually take the time to learn what it is,
I truly love and admire Chef Sean Sherman more than I can tell you. Thank you so much for being here.
Pilame.
I have to catch my breath. This has been such an amazing afternoon, everyone. I am incredibly inspired by all the work that we have heard from the incredible speakers. To help us close out the portion of the day, I'd like to welcome back to the stage Rachel Ferencik, the CDC Foundation's Senior Program Officer. Please make sure to stay with us. There's still There's still much more time to come. After this conversation, we'll split up into those breakout sessions that I mentioned before, where you'll have a chance to respond to respond to what you've heard this afternoon, and then head into that fantastic reception. And I swear, if you don't make it to that reception, you're going to be very disappointed. So, round of applause for Rachel. Rachel.
Danny, are you sure you don't want to end with Sean Sherman? That was really fantastic.
No, he's so great.
Yeah.
He's so great.
And also, can we have a round of applause for you? You've been out here for 4.5 hours.
Thank you. Thank you. Thank you, everyone.
Thank you.
I apologize for my vocal fry, but thank you for listening to me today. Rachel, what did you think? I saw you over there furiously taking notes. What did you think of today? What stood out?
I love it. I'm inspired. I also feel kind of enthusiastically exhausted after hearing all the great things. So many things stood out to me, and I took way too many notes and tried to make sense of them. I just put some things in some groupings and just thought I'd mention them.
Yeah, please.
Right, partnerships. That's been a big theme. Yep. Cross-sector, cross-boundaries, really knowing that we're really all interdependent with each other. Sean Sherman mentioned that. I mean, it came out in so many ways. So farmers as partners, really inspiring to think of it that way. We heard a lot about policies at the state, local, federal level. More states need to get on board with summer EBT. Food is medicine, earned income tax credit, and the child tax credit. What a powerful lever that was and that could continue to be. Fully funding WIC and the Farm Bill. People are at the heart of this work. This work really needs to remain rooted in community, with lived experience. Pay people for their time when they're coming to do this work. Food is local and it's cultural. We need a food system that's local. Profits. Local farmers deserve to make profits. Let's make that happen. And it might be a little risky to say, but we need to talk about corporate profits as well. People want to make a living to be able to buy their own food, right? That's what it comes down to. So let's help people doing the work make more money.
Yay.
Those are a few thoughts.
That was great. Thank you so much. I'm wondering how you can tell people who are here and excited and exhausted how they can get involved with this, with the administration, with the CDC Foundation to continue this work.
Sure. So as you know, the White House did their challenge, and we're going to try to keep that momentum moving. That's our objective. There's so much great work out there that we don't want to replicate, duplicate. We want to help create the conditions for more of this to happen. So I mentioned we have a webinar next Wednesday. I'm happy you can go to impacthunger.org and find out about it. You can also give us your email address, and we will keep you informed as we move forward. So again, we want to help make these, help create the conditions for more of this to happen. We want to be able to lift up the great work that's already been happening. What else are we trying to do? We want to highlight what works for whom and under what conditions. And, we just want to, people want to know not just what's happening, but how it's happened. Mm-hmm. So, that's another thing is we want to highlight how is this work happening? What are the factors that are maybe happening in one place that could work in somewhere else, or maybe not so much. So that's what we want to try to do, and I hope folks will try to stay connected with us.
How can they stay connected? Do you want to give them a website?
Yeah, impacthunger.org.
Awesome. Impacthunger.org. Please give Rachel a round of applause, everyone. She's been awesome.
Thanks, Danny.
Thank you. So again, we've had such a wonderful afternoon. I want to thank everyone for joining us both in person and online. I want to thank Duke's World Food Policy Center once again for hosting today's summit and their incredible partnership. Round of applause for them, please. Thank you to Bonterra Organic Estates, Ponysaurus Brewing, and Ahold Delhaize USA for all of their support on today's event and making the lunch and reception that's coming up possible. A huge thanks to Mode everywhere in this room, especially Andre Martinez for for making sure today's program was flawless. I love them more than you can know. Thank you to the entire Food Tank team, including my co-founder Bernard Pollock, and our staff, Elena Seeley and Kenzie Wade, who is over there, and all of our volunteers who work behind the scenes. To the live stream audience, thank you again so much for being here. We appreciate you spending your Sunday with us, so thank you. We hope to see you soon at another Food Tank event.